You ready, Frank?
It's 2 minutes.
Yeah. Good morning, everybody. So I call this meeting of the House and Senate Conferees on S-524, the Comprehensive Addiction and Recovery Act, CARA, of 2016 to order. And at the outset, I'd like to make a few procedural announcements as well as a few requests of my fellow conferees. We've allowed 2 minutes for each member to make an opening statement. Last night, 16 amendments were filed. I have to say that more than we anticipated when we scheduled the meeting last week. Votes are expected in the House and Senate sometime between 2 and 3 this afternoon, and in order to be respectful of everyone's time and in order to move through the amendments that have been filed, I'm going to strongly urge my fellow conferees to offer their statement for the record rather than use their 2 minutes of statement time today. If you decide you need to speak, I would ask that you try to use only 1 minute of your time so we can move expeditiously to the consideration of amendments. This room is aptly named the John Dingell room. It is his 90th birthday, and later on this afternoon there is a celebration in support of his birthday, so we would like to be done by the time votes start, knowing that there is another event that we have to use this room for. So in the spirit of moving things forward, I would welcome all of you to the conference on S-524, the CARA Act. I look forward to deliberations today, and I will submit my opening statement for the record.
Mr. Chairman.
I would recognize the gentleman from Tennessee.
When would it be appropriate to name a chairman of the conference?
Right now, I think is fine.
Mr. Chairman, I nominate the chairman as chairman of the conference.
Yeah. Gentleman from Vermont seconds that. Is there objection? If not, I am named as chairman of the conference. Yeah, thank you. So I would now recognize Senator Grassley for 2 minutes. I've urged folks not to use their time if they.
Somebody else for a minute.
Okay, Mr. Leahy is recognized.
Thank you, Mr. Chairman, and I'll be brief. With consent, I'll put my full statement on the record. But I did want to be here because I've never seen anything like this in my own state, the opioid addiction epidemic. From my years and as a parent, a grandparent, years as a prosecutor, I've never seen this. I've held Senate Judiciary Committee field hearings, had conversations across kitchen tables. I've heard how this has torn apart families, overwhelmed communities, destroyed lives. We're desperate for help. That's why we're here to help, because, Mr. Chairman, all of you represent communities just like we have in Vermont. There is not a state or a district that isn't facing this. We're in this together. And I think if we stick together, we can do something about it. I ushered the Comprehensive Addiction and Recovery Act, CARA, through the Senate. For far too long, the knee-jerk reaction was punitive on addiction. What we did was we showed that you combat addiction as you would any other disease. Prevention, treatment, recovery. I think that I worry in the draft conference report that we have programs administered by the Attorney General, and they're stripped out these strategies that are best practices. Evidence shows that. It replaces the structure of the Senate CARA legislation, which Senator Grass and I supported, with a block grant. That would place important programs in jeopardy, such as the Senate Heroin Task Force. And we also need real funding. What I'm saying is, any one of us, if we go home and we have honest conversations at home, we are going to find people who have families that have been torn apart by addiction, suicides that could have been avoided, families destroyed, and they're looking to us to do something. Thank you, Mr. Chairman.
Gentleman's time has expired. Other members wishing to make an opening statement? The chair would recognize the gentleman from New Jersey, Mr. Palone.
Thank you, Mr. Chairman, and I'll try to summarize. The opioid abuse epidemic has taken a tremendous toll on families and communities around the country. While there are important provisions in this conference agreement that will help us begin to address this epidemic, we cannot and should not approve any conference report that does not provide funding. House and Senate Democratic conferees have put forward bipartisan pay-fors that we all support, so there is no excuse for us failing to make the federal investments necessary to begin to turn the tide in this public health crisis. I strongly support the provisions that expand access to treatment services, but they'll largely remain just that, ideas, if we do not provide the federal funding necessary to help states and local communities respond to the crisis. Those on the front lines of the crisis have been clear about the urgent need for immediate funding. The National Governors Association and 182 advocacy groups have written to us urging us to include federal funding in this package, and we should listen to them and add the funding. Mr. Chairman, there are two specific policies that are included that I believe are critically important to our response to this epidemic. We need an all-hands-on-deck approach to this crisis, and that's why I strongly support the provision allowing nurse practitioners and physician assistants to treat individuals with opiate use disorders with BUP. The conference report also clarifies that a doctor or patient may request that a prescription for a Schedule II substance, such as an opioid, be partially filled. This important change could help reduce the amount of opioids dispensed unnecessarily, reduce the number of unused pills in circulation, and therefore reduce the risk of opioid misuse, diversion, and overdose. So again, Mr. Chairman, I believe that this conference report substantively is a good conference report, but without the funding, I cannot agree to support it at this time, and I would urge that we include funding.
Gentleman's time has expired. Chair would recognize the gentleman from Iowa, the Honorable Mr. Grassley.
You've heard the annual figure of about 40-some thousand people dying from this overdose every year. So that's 129 Americans a day dying from drug overdose. 129 of our sons and daughters, brothers and sisters, parents, spouses, co-workers, friends and neighbors lost to addiction every 24 hours. It's a human tragedy that touches communities of all shapes and sizes across the United States. Despite the awful toll of this epidemic, I've been inspired by how many of our fellow citizens have turned their personal tragedies into stories of hope for others. I've heard these stories across my state of Iowa. The Senate Judiciary heard them during a hearing I convened on this crisis in January. Now Congress has an opportunity to do our part and pass this landmark bill, CARA. It's a comprehensive approach authorizing almost $900 million over 5 years for prevention, education, treatment, recovery, and law enforcement. I was proud to lead the bill through the committee and manage its near unanimous approval by the full Senate. I'm pleased that the bill now also includes the Kingpin Designation Improvement Act, which I introduced with Senator Amy Klobuchar of Minnesota. And after all of our hard work, CARA now represents the collective effort of both Democrats and Republicans from both the House and Senate. The time for us to act is now. Let's not let another 129 Americans lose their lives without approving the conference report this very day, as over 100 advocacy organizations have urged us to do. Let's move CARA one step closer to becoming law.
Gentleman yields back. Chair would recognize the Majority Leader of the House, Mr. McCarthy from California, for an opening statement.
Well, thank you, Mr. Chairman. Mr. Chairman, before I begin, I want to thank you for your work on this issue and many others and not giving up, and I appreciate that. Mr. Chairman, the opioid crisis continues unabated in our country. Families are suffering. Communities, as we know, are being torn apart. Those who are addicted are deprived of their basic freedom of will. And now we have a chance to reverse this and give the people new hope. Government can't end addiction, but it can support community efforts to stop opioid abuse and help those in recovery. Now, the House bill has targeted the root causes and the results of the opioid epidemic: the drug trade, prescription abuse, health care, prevention, and recovery. But we aren't just creating new programs with the hope that more money attached to some new Washington acronym will solve our problems. Such problems are generally created with good intentions. But good intentions don't make good government. This legislation uses the power of data to determine if the programs we are funding to fight opioid addiction actually works. That's the purpose of the Open Act, which I sponsored with Minority Whip Steny Hoyer, and which is part of this conference report. It gives healthcare officials, researchers, and engaged citizens the opportunity to see exactly what their government is doing and use that information to respond to the opioid epidemic. I want to thank the chairman and the committees and all the conferees for their bipartisan work over the many months to get to where we are today. But today is not where we should end. We have to finish this, and the sooner the better, to save more lives. I look forward to working together to get this bill signed into law, and I yield back.
Gentleman yields back. Chair recognizes the gentleman from Tennessee, Mr. Alexander.
Thanks, Mr. Chairman. Each year, the opioid abuse epidemic is killing more Tennesseans than car accidents or gunshots do. More than 1,000 Tennesseans die from an opioid abuse every year. Last month, the headline in a Knoxville newspaper said, "Opioid crisis hard for officials to get a handle on." The way to fight this epidemic is not to wage a battle from Washington, but to support those who are waging the battle on the front lines, county by county, doctor's office by doctor's office. What we are doing today should afford substantial help, supporting education, prevention, and treatment, providing grants to expand access to life-saving opioid overdose reversal medications, providing grants to states to carry out a comprehensive response. This legislation is about program reform. This Comprehensive Addiction and Recovery Act passed the Senate 94-1. It passed the House 400-5. We should finish its work today. 184 different advocacy groups signed a letter yesterday saying they supported the conference report. It is bipartisan. It includes the work of many members. Money helps. Money helps. And over the last 2 years, Congress has increased funding for opioids by 7 times, 766% if we include the recommendations of what the Senate Appropriations Committee has recommended this year, and we've not yet heard from the House. This is the regular order. When we fixed No Child Left Behind, we didn't appropriate dollars. When we pass the defense bill, we don't spend dollars. We do that on the spending track, and both tracks have been working well. There are important discussions going on about finish our work on funding. I'm glad to be a part of this committee. It's important we get a result today.
Gentleman yields back. Chair would recognize the gentlelady from Washington State, Senator Patty Murray.
Thank you, Mr. Chairman. I want to start by sharing something that my constituent Penny Legate, whose daughter died of an overdose, said before about the opioid epidemic. She said, "It can happen to anyone. It is everywhere." And she is right. No one is immune to this disease. In 2014, opioids killed more than 28,000 people nationwide, more than any other year on record. The number of heroin overdose deaths nearly quadrupled from 2000 to 2013. This epidemic is hurting children, parents, grandparents, friends, and neighbors all across our country. So I'm glad we were able to reach bipartisan agreement on many policies that we are debating today. But just changing policies alone will not be enough. We all know that without more funding to expand access to medication-assisted treatment, states simply won't have the resources they need to put people on the path to recovery and save lives. I'm very concerned that if we pass a bill that changes our nation's opioid policies but completely ignores the funding that would enable cities and states to put these policies into practice, the funding might never come. For too many families, there is no later. There is no next time. This is the opioid bill this year, and frankly, people across the country are running out of time. That's why I'm introducing an amendment that lays out a clear plan for investing desperately needed resources in preventing and treating opioid addiction so that families and communities get the relief they are calling for. I hope all of our colleagues will join me in supporting it, especially since so many of us on both sides of the aisle agreed heading into conference that new investments in prevention, treatment, and recovery are necessary. We have an opportunity and the clear responsibility to take life-saving action on this issue today. We have a choice between preventing more of the deaths we've all heard too much about and allowing the status quo to continue. For mothers like Penny and many others who are suffering as a result of opioid addiction all across the country, let's make the right choice today.
Gentlelady yields back. Chair would recognize the gentleman from New Mexico, Mr. Lujan, for an opening statement.
Thank you very much, Mr. Chairman. 2014, 47,055 people died from drug overdose. Opioid overdose accounted for 28,000 deaths, an increase of 200% since 2000. My home state of New Mexico has been especially hard hit by this crisis, and in 2014 alone, 547 people lost their lives. 547 people who missed Thanksgiving dinner or their daughter's softball game, 547 people who weren't able to help their son with their math homework or kiss their daughter, their spouse goodnight. 547 brothers, sisters, parents, and friends that we lost too soon. I know that the members of this conference committee are committed to helping our communities because this crisis touches everyone. Every member of this committee represents someone who has suffered, and many of our constituents have experienced this tragedy firsthand. These are our friends, our loved ones, our neighbors. But if we want to address this crisis in a meaningful way, in a way that will save lives, then we need to do more. We need to make real investments and provide funding for this package. Take legislation I introduced, the Improving Pregnant and Postpartum Women Act. It passed with overwhelming bipartisan support, and I'm encouraged that its inclusion will help mothers get the care they need to put their families on the right path. But for this effort to make a difference, we must provide robust funding. Continuing the status quo will not work. If we're going to successfully combat this epidemic, save lives, and help people, then we must provide more resources, more funding. The work we are doing today is so important. No single solution will solve this crisis, but we have the opportunity to invest in the tools needed to combat this crisis and save lives. I again thank my colleagues for their efforts to address this epidemic, but we need to do more, and I hope we can come together today to do what is right. With that, Mr. Chairman, thank you very much, and I yield back.
Gentleman yields back. Chair would recognize the gentleman from Utah, Mr. Hatch, for an opening statement.
Well, I'm very glad to see that the Senate and House are coming together to tackle this very important issue of opioid abuse, and I'm very pleased to serve as a conferee. This is an epidemic that is devastating individuals, families, and communities across the country. And my own home state of Utah has been particularly hard hit. In 2014 alone, 289 Utahns died due to opioid abuse, which was more than half of all drug overdose-related deaths in the state for that total year. So through a series of bipartisan votes in both chambers, we are now poised to take action on a conference agreement that the American people want and deserve. I was pleased to vote for the Senate CARA bill when it was reported out of the Judiciary Committee and when it passed by a vote of 94-1 on the Senate floor. I commend Senator Portman, who worked for years alongside Senator Whitehouse, and I commend him as well for his leadership, for their leadership on CARA. I must also recognize Senator Ayotte, as she has long been a true champion of this issue as well. Speaking as the chairman of the Finance Committee, I'm pleased that this agreement provides Medicare with an important tool in the fight against opioid abuse. The agreement allows Medicare Part D prescription drug plans to work with at-risk beneficiaries to identify one physician to prescribe opioids and one pharmacy to fill all the opioid prescriptions. This is a common sense step that will improve patient care and reduce abuse. It also makes it more likely that beneficiaries with a problem get the help that they need. I commend Senator Toomey, who worked with Senator Brown, for his leadership on this issue, as well as Senator Brown. The agreement also increases access to medication-assisted treatment. I'm proud of our past work on this issue and appreciate the improvement made by this agreement. I put the rest of my remarks in the record.
Appreciate that. Gentleman yields back. Chair would recognize the gentleman, Chairman of the House Judiciary Committee, Mr. Goodlatte, for an opening statement.
Thank you, Mr. Chairman, and I'm pleased to be here today, and I commend my colleagues for their hard work on this conference report. Over the past several weeks, conferees and staff worked diligently to produce the conference report in front of us today, which represents a comprehensive response to the opioid epidemic plaguing our nation. In particular, I'm pleased that the conference report preserves the comprehensive Justice Department opioid grant program from H.R. 5046, the Comprehensive Opioid Abuse Reduction Act, sponsored by my colleague and friend and fellow conferee Jim Sensenbrenner. I believe this program will do a great deal to help stem the epidemic of opioid abuse by offering states and localities the resources needed to fight opioid addiction and the flexibility to use the grant dollars to address their unique needs. Importantly, the comprehensive DOJ grant program is authorized at $103 million annually over 5 years and is fully offset in accordance with the House's cut-go protocol. I'm also thankful to Chairman Rogers, Chairman Culberson, and our colleagues at the House Appropriations Committee who worked closely with us in this effort. This year, the House appropriators have included $103 million in funding for anti-opioid activities in the CJS appropriations bill, which aligns with the authorization amount in H.R. 5046. Additionally, the conference report includes the provisions of the other bills in the jurisdiction of the House Judiciary Committee, including H.R. 5048, the Good Samaritan Assessment Act, H.R. 5042, the Open Act, and H.R. 4985, the Kingpin Designation Improvement Act. Along with the other provisions in the conference report, these bills take real steps to address the opioid epidemic and provide real relief to a real problem affecting real Americans. Members of this body should be proud of these accomplishments. I support the conference report and urge my colleagues to do the same.
Gentleman yields back. Chair would recognize former member of this committee, Mr. Wyden from Oregon, for 2 minutes.
Thank you, Chairman Upton. Opioid addiction is ripping through many American communities like wildfire. And in my view, you cannot fight an inferno with a treatment and prevention package that is no more than a thimble full of water. There have to be financial resources that reflect the magnitude of the problem. Resources that prevent opioid addiction from escalating in the first place. Resources that strengthen enforcement to ensure bad actors don't rip off the system. Resources that get better access to treatment for our people. It would be legislative malpractice for Congress to do only half the job while the crisis continues to rage across America. Action needs to be taken today to lock in real funds to deal with this epidemic. I'm sorry to say the measure being considered now falls short. The conference does have an opportunity, and that is to come together in a bipartisan fashion. And I note Chairman Upton's comments. There's been an awful lot of bipartisan work done in this committee over the years. And it's my hope that we can work together in a bipartisan way to improve this bill today and lock in.
Chair would recognize Mr. Sarbanes for an opening statement.
Thank you, Mr. Chairman. I'm glad that we're gathered here now to make some progress with respect to this scourge, this epidemic of the opioid and heroin addiction and crisis across the country, and bring together the efforts of both chambers. I had the opportunity to participate with Senator Cardin of Maryland about 2 months ago in a roundtable discussion in Anne Arundel County in Annapolis in my district in the state of Maryland. And we brought together in that forum a diverse group of advocates, treatment providers, first responders, hospital personnel, law enforcement, all of the people who professionally now are affected by and are trying to respond to this crisis of opioid and heroin addiction across the country, a crisis obviously that's touching just about every community in our country. And much of the discussion, as you would imagine, as much of the components of the legislation that we're looking at today was addressing public awareness, education, breaking down the silos that exist among all the different parts of the community that can mount an effective response to this crisis. But in addition, of course, there was a discussion of trying to bring resources to bear to make a real difference. And in particular, the treatment providers who are at the table and part of that discussion are making the point that they need more resources. So in addition to the things that are achieved through the legislation that we're going to be looking at today, bringing more resources to bear so that the response can be what the American people, I think, expect it to be, and I think are prepared to put resources behind, is a critical part of the conversation, and I hope that we can bring more resources behind this effort. And with that, I yield back.
Gentleman yields back. Chair would recognize the gentleman from New Jersey, Mr. Lance, for an opening statement.
Thank you, Mr. Chairman. I ask that my remarks be made part of the written record, and I yield back 1 minute, 55 seconds.
All right. Thank you, sir. Chair would recognize a gentleman from Texas. I thought I was going to come in, Mr. Smith. Lamar, opening statement, 2 minutes.
Thank you, Mr. Chairman. The United States is experiencing an opioid abuse epidemic. 25% of patients who are prescribed opioids for long-term pain subsequently battle addiction. As many as 2 million Americans abuse or depend on prescription opioids. And tens of thousands of Americans die each year from opioid overdoses. These deaths are preventable, yet have quadrupled since 1999. The House and Senate have approved versions of the Comprehensive Addiction and Recovery Act. I am a co-sponsor of the House bill. Today, Congress moves closer towards combating opioid addiction. The bipartisan conference report ensures that the necessary resources are in place to prevent or respond to opioid abuse. I thank my colleagues here today and the authors of the House and Senate legislation for their efforts, and I urge adoption of the conference report and yield back.
Gentleman yields back. Chair would recognize the gentleman from Texas, Mr. Green, for an opening statement.
Prescription drug and heroin addiction crisis has ravaged so many of our families and neighbors and communities in every corner of the country. Nearly every 12 minutes, someone in America dies from a drug overdose. It's a grave reality, and we must face it head on. I support the underlying legislation and believe these programs and authorizations have the potential to help expand access to treatment, improve prescribing practices, facilitate understanding of disease, and educate providers, policymakers, and the public. However, absent actual resources to address this crisis head-on and meaningfully impact those affected, I'm afraid will accomplish little. Mr. Chairman, I join my colleagues in urging us to include robust funding for the opioid epidemic. As we stated in our recent letter, the scope and urgency of the opioid crisis will justify this investment being considered emergency spending. And yet we're willing to put federal budget savings on the table, demonstrating that there's no excuse for inaction when it comes to funding for treatment and prevention of opioid addiction. I'm going to thank my colleagues and the staff for their work to move this issue forward, and I yield back the balance of my time.
Thank you, sir. Gentleman, next is Mr. Guthrie from Kentucky. It's recognized for an opening statement.
Thank you, Mr. Chairman. I will submit my formal remarks for the record, but I do want to say on June the 30th in Owensboro, Kentucky, I attended a forum on opioids, and we talked about a lot of statistics of people who have passed away and moved forward. We had a mother there that's child was the honor student in high school, the stories that we hear. Honor student in high school, played soccer, tore her ACL, and went to a physician, got a prescription, and then became addicted to opioids, which led to heroin. In the 2 years that the family went through, she described, including relocating to Owensboro just to get out of the neighboring state where this happened. Her daughter went home to visit a friend and came back and found her dead after she thought that she was clean. But these are the stories that are throughout the country. They're not just numbers, they're stories. And in the honor of her and her daughter, I urge that we do move this legislation forward, and I will submit the rest of my remarks for the record. Thank you. I yield back.
Gentleman yields back. Chair would recognize the gentleman from Tennessee, Mr. Cohen, for an opening.
Thank you, Mr. Chair and members of the committee. I applaud the bill, but I want to suggest that one of the major reasons we have an opioid problem in this country, one of the reasons young people use heroin, is because this Congress and governments throughout this country have wrongly sent a message to young people that marijuana is more dangerous to you than heroin. That's the message we send by having marijuana as Schedule 1, that marijuana is more dangerous than heroin. Young people see that, and they think government lies to them about drugs. And they try marijuana, and they find out that it's not harmful and that it doesn't ruin their lives. Not that they should be doing it when they're under 21. Not that they should even necessarily be doing it later, but in D.C. and many states you can do it legally, and people do it and aren't killing themselves and aren't committing crime because they do it. But this Congress and governments throughout this land have told young people, we are old fogies, we don't know what we're talking about, we think marijuana is more dangerous than heroin. Therefore, they think it's okay to do heroin, and then they die. We need to be straight and honest, and marijuana should not be Schedule 1. It really shouldn't be scheduled, but at a minimum, should be Schedule 2, as is this drug in this particular bill. Schedule 1 for marijuana is wrong, and it is an alternative painkiller that could do good for people who would not then go to prescription drugs and get hooked on opioids and maybe kill themselves. So let's get straight and let's make our laws realistic and not have people think it's a bunch of old fogies that don't know what they're doing and they lie to us. Furthermore, I say it's not, and I yield back the balance of my time.
Gentleman yields back. Chair would recognize the gentlelady from California, Ms. Chu, for an opening statement.
Thank you, Mr. Chair. Decades ago, I was a drug abuse counselor helping people detox off heroin and barbiturates. It is alarming to see that today, opiate and heroin abuse is once again on the rise. It is, in fact, at epidemic levels in every community throughout our country, including my state of California, which, according to the CDC, saw 4,521 drug overdose deaths in 2014 alone. Recently in my district in Pasadena, I met Ryan Hampton, who, like 4 in 5 new heroin users, began by using prescription drugs. He was once an ambitious White House intern who was succeeding in college, but then he broke his knee while hiking and was put on prescription opiates for pain. Ryan, like so many other young people, became dependent on prescription drugs and started running out of his prescriptions too fast. He was then labeled a drug seeker and discharged from medical care. Without any other option, he turned to heroin. The fall into heroin addiction was quick, and within months he was homeless and living on the streets. Ryan sought treatment after overdosing and was told his life depended on it. But there was a month-long waiting list for accessing publicly available treatment options. Thankfully, one of his family members was able to send him to a self-pay treatment program. But most are not that lucky. He told me that if he had to wait the 30 days to access care, he would have been one of the tragic overdose statistics that we are talking about today. And that is why passing a comprehensive policy package with the necessary funding is so critical. And I cannot support this package without a funding commitment from Congress. We cannot deliver the promises of this bill without it. So let's increase prevention programs and access to treatment and recovery. Let's fund these programs so that we can save lives.
Gentlelady yields back. Chair would recognize the gentlelady from Connecticut, Ms. Esty, for an opening statement.
Thank you, Mr. Chairman. As a state legislator in 2009, I began working to prevent the destruction of prescription drug addiction. And now, as a member of Congress, I receive calls virtually every day in my office from families struggling with the destruction of heroin or drug addiction. And it is a public health emergency, and Congress needs to treat it like one. So I am pleased that we are coming together here today. More than 120 Americans will die today from drug addiction. And by the time we conclude this meeting, another 12 American lives will be lost. The policies and proposals in this bill are important and they will help. But without adequate funding, we are not doing our job. It is very easy to stand up and cheer for good policies, to tell our constituents, to tell the service providers, to tell the heroin addiction counselors that we're with them, we support them. But unless we provide them the funding, the states are in crisis, our communities are in crisis, our providers are in crisis. And to do that, we need to do our job, and that is to provide them the resources to do their job and save lives. So I hope we can continue to work together and not only support these important policies, but give them the resources so that the folks on the streets, in the clinics, in our communities, our law enforcement can do their jobs and help these families. Thank you very much, and with that, I yield back.
Gentlelady yields back. Chair would recognize the gentleman from the great state of Michigan, Mr. Conyers, for an opening statement.
Thank you, Chairman Upton. Ladies and gentlemen, the crisis of opioid abuse and addiction clearly requires our immediate attention. In my state of Michigan, for example, there were 1,745 drug overdose deaths in 2014, and more than half of those overdose deaths were caused by opioids and heroin. Each day, 78 Americans die for an opioid overdose. Fortunately, we now have better ways of addressing issues of addiction, and we know that incarceration is not the answer. We know that there are effective ways to get addicts to treatment and to quickly provide them with needed services that address their addiction and prevent recidivism. And we know also that evidence-based treatment and alternatives to incarceration work. Title II of this bill reflects much of this approach in the grant program as reported by the Judiciary Committee and passed by the House. While I've supported this effort, I also support alternative approaches that would provide separate grant programs for many of these worthy purposes. But regardless of which approach this conference committee adopts, we must do more than simply authorize funding. We must provide real dollars that are urgently needed by those fighting this crisis. To emphasize this, I ask unanimous consent to enter into the record a letter that police chiefs participating in the Police-Assisted Addiction and Recovery Initiative sent to us, urging that we provide $1.1 billion in increased funding to address this issue. I ask you...
Without objection.
Thank you. That will be the true measure of success of this legislative effort, and I thank the chair and yield back the balance of my time.
Gentleman yields back. Chair would recognize the gentlelady from Texas, Ms. Sheila Jackson Lee, for an opening statement.
Mr. Chairman, thank you very much, and I am pleased in this significant moment of history to join my colleagues who have come together with a similar and very important purpose, and that is to save lives. As the ranking member on the Judiciary Committee dealing with crime, we see the aftermath over the years of a wrong policy. Let me simply add to the record some very startling facts. On an average day in the United States, more than 650,000 opioid prescriptions are dispensed. 3,900 people initiate non-medical use of prescription opioids. 580 people initiate heroin use. 78 people die from an opioid related death. $55 billion in health and social costs related to prescription opioid abuse each year, and $20 billion in emergency department and inpatient care from opioid poisonings. This conference committee is on the right direction. There are worthy bills. The problem is huge. Between 2000 and 2014, almost 500,000 people died from drug overdoses, based upon the statistics I've just read. Our goal must be to adopt legislation, but also to fulfill our obligation for full funding. I'm very glad to have been a co-sponsor of the primary contribution of the Judiciary Committee, H.R. 5046, Comprehensive Opioid Abuse Reduction Act. Glad to work with my ranking member and chairman and the chairman of the subcommittee, the crime subcommittee. The text of 5046 is largely incorporated into the draft conference report that has been provided to us and would establish a grant program to be administered by the Department of Justice to assist states and local governments, particularly by helping criminal justice agencies to tackle the opioid problem from a variety of angles. It would encourage the development of alternatives to incarceration that would provide treatment as a solution to the underlying motivation for criminal behavior or conduct associated with mental disorders. Breaking news, there are no mandatory minimums in this legislation. Combined with other treatment programs under the jurisdiction of other committees and proposed to be included in the conference report, the approach Congress is taking with the crisis of heroin and other opioids is thoughtful and comprehensive. The National Association of Counties in the United States has one of their suggestions or elements is provide for greater use of Nexalone. We have done that. We're training police officers. I hope it signals a departure from some of the failed approaches concerning other drug crises in the past. For instance, many of you know that our response to the surge in crack cocaine, powder cocaine, in the 1980s was to enact an enormous amount of draconian mandatory minimum penalties with vastly disparate treatment for crack and powder cocaine. At that time, Congress took action that we are still trying to rectify. So in conclusion, Mr. Chairman, let me make one final point. We know that in that instance, many of those who were incarcerated were African Americans. Today we have an opportunity to turn the page on heroin, as I hope we'll turn the page going forward, dealing with these drastic and terrible acts that impact society and cause great death. With that, I yield back.
Gentlelady's time has expired. Chair would recognize the gentlelady from New Hampshire, Ms. Custer, for an opening statement.
Thank you, Mr. Chair, and thank you to all of the bipartisan conferees taking part in this historic conference today. Many of the people in this room from both chambers and from both parties have been working for a long time to address the challenges of addiction as the opioid and heroin epidemic has swept across our country. In my home state of New Hampshire, the epidemic continues to grow. In 2015, the total number of drug overdoses in the state surpassed 435, and our population is only 1.3 million people, far exceeding the record set just 1 year before at 325 and well over double the amount we had in 2013. This rapid rise in overdose rates reflects a deadly combination in New Hampshire. We have one of the nation's highest addiction rates, but rank second to last in treatment capacity. The bill before us today and the programs included within it will provide crucial tools to help us begin to address this epidemic, from allowing nurse practitioners to prescribe buprenorphine under the supervision of a doctor, to treatment alternatives to incarceration, to building communities of recovery and improving prevention and education efforts. However, this legislation still falls short of where we need to be. With 129 Americans dying each and every day from overdose, action is needed now. The lack of funding included in this proposal represents a hole in this package and will hamper our ability to provide education, treatment, and recovery services in our communities across the country. With amendments still to be considered later today, I urge my colleagues on both sides of the aisle, please support Representative Pallone's amendment and ensure emergency funding for this legislation. By doing so, we can deliver help to those in need before it is too late. Thank you, Mr. Chairman. I yield back.
Gentlelady yields back. Chair would recognize the gentleman from Georgia, Mr. Collins, for an opening statement.
Thank you, Mr. Chairman. I appreciate the opportunity to be a part of this and all the work the staff and others have went into. We can just hear by the opening statements the magnitude of what we're dealing with, and I think that is affected as well in the state of Georgia, where the Georgia Bureau of Investigation reports that heroin overdoses are up by 300% this year. My sheriffs say it has become, again, a rehash for one of the longest times where they see it more regularly now than they see any other confiscation in many other areas. I'm appreciative of the conference report, and the text of this Comprehensive Addiction Recovery Act contains many important provisions, but I just want to focus on one very quickly, and that is Section 502. This is particularly close to my heart. It's a section that deals with the grant process to establish and expand veterans treatment courts. As a member of the Air Force, as a chaplain who has served overseas, it is startling, these statistics. That's why I introduced the Comprehensive Justice and Mental Health Act to expand veterans treatment courts. And most of the language is reflected in this conference report because opioid epidemic clearly and tragically affects veterans. Real quickly, the VA says that 1 in 3 veterans seeking treatment for substance abuse disorders also have PTSD. 1 in 6 veterans of Operation Enduring Freedom or Iraqi Freedom suffer substance abuse. We need to help them, and we should not cast them aside. I've seen the pain that this causes, not only in our military, but in our families every day. I'm pleased with the report so far. I look forward to the continuing efforts of this conference report to bring forward help in this crisis, and with that, I yield back.
Chairman yields back. Chair would recognize Mr. Courtney from Connecticut for an opening statement.
Thank you, Mr. Chairman. In 2004, the Center for Disease Control tallied 7,000 Americans lost their lives to heroin opioid overdoses. If you fast forward to 2014, the last year they have full statistics, that number grew 4 times. 28,000 Americans lost their lives to heroin and opioid overdoses. We know 2015, because of state-by-state numbers, is going to be worse, and 2016 is off to a horrendous start as well. Mr. Chairman, if there was an infectious disease that was causing this kind of harm to our country, if there was a natural disaster that was causing this kind of havoc to our country, this Congress would be on fire in terms of getting emergency funding out into the country to deal with this devastation. This bill contains many good provisions in terms of policy changes, authorizing languages, but the absence of any real resources to help families who right now, as we're sitting in this room, are scrambling to try and find a detox bed or a long-term treatment bed, a police department where they have an addict in lockup that they're trying to get out and into a treatment program, an emergency room where a doctor has brought someone back to life with Narcan, is watching that patient leave, again, with no treatment options available. We need to get much more serious about dealing with the overwhelming avalanche of harm and need that exists in this country. The Pallone Amendment, which will be offered later, provides a fully paid for amount of resources that deals with prevention, it deals with treatment, and also gives resources in terms of education and law enforcement. This is the approach that ultimately is going to make a real difference to those families who are looking to us desperately for help so that they can help their loved ones get the treatment that we know works. And again, we have that power, we have that opportunity. We should view this just like we would any natural disaster. We should view this like any other type of, again, infectious disease epidemic that, again, over and over again, we as a great nation has stood up and responded to with real resources to get help to the people that we represent. I yield back.
Gentleman yields back. The chair would recognize the gentleman from Indiana, Dr. Bashan, for an opening statement.
Thank you, Mr. Chairman. I'm pleased to support the report before us today, specifically Section 303, which is compromise language based on my legislation, the Opioid Use Disorder Treatment Expansion and Modernization Act, and the TREAT Act as passed by the Senate Help Committee. I will submit the remainder of my remarks for the record, and I yield back.
Thank you. Gentleman yields back. Chair would recognize the gentleman from Virginia, Mr. Scott, for an opening statement.
Thank you, Mr. Chairman. Mr. Chairman, as the original sponsor of the House version of the Comprehensive Care Bill, I know that we have an opportunity to make a real difference in people's lives. We're losing far too many people to opioid addiction, and research tells us that we must address this crisis as a public health issue, not a criminal justice issue. There are any number of evidence-based solutions that can effectively address the epidemic, and many of them are found in this bill that are focused on prevention, early intervention, and rehabilitation. We also know that states and localities need more resources to respond to this crisis, and while this conference report takes a positive step in the right direction by authorizing several new programs to combat opioid addiction, we need to take the next step by authorizing funding levels necessary to ensure that these programs make the impact they're designed to make. And so we have a choice. We can shortchange these prevention and intervention programs and pay more later in criminal justice expenses, or we can put up the money now, save lives, keep families together, and save money. Mr. Chairman, this is a good bill as far as it goes, but in addition to the funding issue, there is another issue, and that is that the bill should include support for correctional educational initiatives. This provision was included in the Senate-passed legislation and in the House bill that our colleague from Wisconsin, Mr. Sensenbrenner, introduced, to which I was proud to be a co-sponsor. That bill has over 100 co-sponsors, and including over 40 Republicans. And so because of the need of the programs to assist those already in the justice system and the broad bipartisan support such an initiative has received, I'll be introducing an amendment which will include correctional educational activities as an allowable use for state block grants to address opioid addiction. Mr. Chairman, I thank you for your leadership, and I yield back the balance of my time.
Gentleman yields back. Chair would recognize the gentleman from the great state of Michigan, Mr. Trott, for 2 minutes.
Thank you, Mr. Chairman. As so many of my colleagues have mentioned this morning, the opioid epidemic has no boundaries and reaches every one of our districts. A few minutes ago, my colleague, Mr. Conyers from Detroit, indicated that 1,700 people passed away in 2014 from opioid abuse. Unfortunately, my district had a disproportionate number of those deaths in 2014. 449 people passed away from heroin and painkiller abuse in Oakland and Wayne County. This legislation we're considering this morning contains some important solutions to fight this problem. First, the bill we passed out of Judiciary provides for a comprehensive grant program to ensure law enforcement and first responders and criminal investigations and drug courts have the resources necessary to fight this problem. Second, it provides for transparency and accountability to ensure that our solution is actually making a difference in reducing the number of deaths because of opioid abuse. And finally, it attacks the root of the problem, allowing Treasury to have the resources to designate international drug traffickers as kingpins in order to prevent them from accessing our financial system for their illicit purposes, and also keep such designation confidential. I applaud the House and the Senate for tackling this important issue, for coming together today to respond responsibly and thoroughly to address this epidemic, and I yield back.
Gentleman yields back. Chair would recognize the gentleman from California, Mr. Reeves, for an opening statement.
Thank you, Mr. Chairman. Today, we come together to address one of our nation's most pressing crises, opioid addiction and abuse. I would like to thank House and Senate leadership for their work on this conference report. In particular, I would like to thank Ranking Member Pallone for his tireless leadership on this issue and for being an important guiding voice on the Energy and Commerce Committee. As my colleagues before me have noted, millions of Americans each year face the devastating impact of drug abuse and addiction. As an emergency medicine physician, I have seen far too many patients who have fallen victim to this horrible cycle of addiction. I remember when a young man, blue with purple lips, was dropped out of a moving car, not breathing. He was rushed into my emergency room, and I intubated him to protect his airway, gave him naloxone and other supportive care, saved his life. But I always wondered if he had the appropriate resources once he left the emergency department to turn his life around, to get treatment, and to live that better life that we all strive for. So I've seen this crushing physical and emotional impact on medication abuse on individuals and their families. Today, we have an incredible opportunity to enact meaningful legislation to combat the epidemic of opioid abuse and help save millions of lives. In 2014, more than 28,000 Americans died because of an opioid abuse. They suffered, their families and loved ones suffered, their communities suffered. Today, more Americans die from drug overdoses than car crashes. In fact, opioid abuse and addiction have become the leading cause of injury and death in the United States. Our constituents are calling on us to act. Now is the time to ensure we provide meaningful resources and support so that millions suffering from this disorder can move forward on the path towards recovery. Sentiments, plans, and ideas are important, but they must include the resources that will allow local, state, and federal officials to implement these ideas and fully address what is truly a public health crisis. That is why I join my colleagues in demanding that our actions reflect the seriousness of this health crisis by including the necessary funding as part of the conference report we will produce today. We need funding so that law enforcement and other first responders are able to reverse the effects of an overdose and save more lives. We need funding so that patients, their families, and the public are educated on the signs, symptoms, and treatment of opioid abuse, and more importantly, how to prevent opioid abuse. We need funding so that programs we implement and support in states around the country are sustainable and make lasting, measurable improvements. We cannot let our words become merely empty promises, and in conclusion, it is critical that we ensure Americans who are suffering receive the resources, treatment, and support they need to overcome addiction so that opioid abuse patients and their families who leave the emergency department have a meaningful chance to heal and to turn their lives around. I yield back my time.
Gentleman's time has expired. The chair would recognize the gentlelady from Indiana, Ms. Brooks, for an opening statement.
Thank you, Mr. Chairman. As my colleagues have talked about, the public health crisis that the heroin and opioid devastation creates, many may not realize that there was a crisis in my home state of Indiana. In Scott County, a rural county in southern Indiana, the HIV/AIDS rates exploded a little over a year ago as a result of IV drug use. And while the spotlight was on Scott County for a period of time, we know this public health crisis happens all across our country. In headlines and more sadly in obituaries in our papers day in and day out. We see rising rates of child welfare cases due largely to the neglect of children from drug-addicted parents, large number of infants being born addicted to opioids, and cycles of recovery, relapse, and addiction. But the epidemic didn't happen overnight. Medical providers and healthcare workers say that much of the crisis began with the overprescription of opioids. Certainly, there is a medical need for pain medications and opioids, but in this country, we've developed a culture of overprescription that is built on patients' expectations and providers' lack of awareness and failure to address this overprescription of these types of medications, which is a major part of the epidemic. What I would say the root from the outset perpetuates the cycle of addiction in our communities. So I urge my colleagues to support this legislation, which includes, beginning with Section 101, the Task Force on Pain Management, which establishes this comprehensive task force comprised of representatives from the relevant federal agencies, as well as expert physicians, recovery specialists, hospitals, dentists, pharmacists, all sorts of groups, health, mental health, and addiction treatment communities, because we must get to the root of this problem. I believe this bill does this. It's going to take all of us working together, and urge my colleagues to support and move forward and give some families some hope. Thank you. I yield back.
Gentlelady yields back. The chair would recognize the gentleman from Washington State, Mr. McDermott. Dr. McDermott, for 2 minutes.
Thank you, Mr. Chairman. I ask unanimous consent that you enter into the record a letter to the chairman by 3 senators and 12 members of the House.
Without objection.
Dated 5 July. The issue here is whether you're going to put the resources. You've heard it over and over and over again. We are preparing today on the floor of the House to adopt a mental health bill that has no money attached to it. You are not going to fix the problems we're talking about here today with good legislation, perfectly designed policies. Policies are wonderful, but you have to have money to implement them. And that's clearly what is the problem with this particular piece that we're working on today. You would have a unanimous signature list at the end of this conference if there was some money. But if there is no money in it, it's like building a house. You say, we got a housing problem, so let's build a house. And you build a nice shell, but you don't connect the electricity, you don't connect the water, you don't connect the sewer system. That is not a functioning house, and that's what you're doing here. This is a public health house we're building, but we're not connecting the utilities that will make it work. And that's really why I think that we must consider Mr. Pallone's amendment in a positive way if we're serious about this. I've heard it about I'm 35th. So I've heard it about 33 times, how many people died and all that stuff. I'm tired of that. The time is to do something, and that means you put some money where your mouth is. I yield back.
Gentleman yields back. The chair would recognize the gentleman from the great state of Michigan, Mr. Bishop, for 2 minutes.
Thank you, Mr. Chairman. I appreciate the opportunity to serve on this conference committee. There are so many statistics that have been cited so far by my colleagues, too many to mention and too many to review again, but suffice it to say that my community is not the only that's seen this epidemic. Too many have suffered as a result of opioids and opioid addiction. This is a ticking time bomb in everybody's district, every community, and I'm therefore very proud that Congress has decided to act. The statistics speak for themselves, and as a father of 3 school-age children, I know full well that an unacceptable percentage of those younger people find it very easy to obtain opioids in every possible form. They're available in every school, in every neighborhood, and the abuse continues to proliferate. This is a crisis that demands urgent attention and urgent action. And while this bill and this conference report does not represent a panacea and the silver bullet, I believe it's a great step in the right direction. And one of the things that it does that I'm very grateful to have as a part of this is that it encourages treatment alternatives and diversion programs. As a former prosecutor, local prosecutor, I saw drug courts in action and know that they're very effective in what they do in addressing this issue. Community-based diversion programs, addiction problems need interdiction and treatment, and I believe that drug courts are very effective at doing that. I'm also very grateful for the fact that this report in Title II includes my amendment to develop and implement technology that will prevent or deter individuals, in particular our children, from going or getting access to opioid medications which have been lawfully prescribed. I want to thank the Conference Committee. My time has concluded, and thank you for your effort today. I yield back.
Gentleman yields back. Chair would recognize the gentleman from Georgia, Mr. Carter.
Thank you, Mr. Chairman. I'm delighted to be here today to take a major step in finalizing this important piece of legislation. Mr. Chairman, I've been a member of this august body for 18 months, and I can think of very few times when I have been any more proud of any legislation that we have passed than what we're working on right now. This is definitely a problem in our country, and I am very proud of this body for recognizing this and for addressing this. I believe that there are numerous challenges that our community health care providers and community leaders face, and this bill will help them address many of those challenges. As a lifelong health care professional, I believe the key to filling any successful prescription is education. This bill does that. It makes improvements to current prevention and education programs to ensure that Americans stay well informed about their medications. I also believe that one key component that has lacked in the past to address opioid addiction has been a real concentration on improving treatment and treatment facilities. This bill does that. Whether it's evidence-based prescription treatment, improving treatment for pregnant and postpartum women, or training of first responder, this conference report provides and improves treatment for all Americans who need it. Finally, as a lifelong pharmacist, I'm glad to see this bill recognizes the need for greater involvement when it comes to prescription drug monitoring programs. As the author of Georgia's PDMP, I believe these programs will continue to play a very important role in our fight against opioid addiction. I believe PDMPs, with the coordination between prescribers and pharmacists, can and will be a cornerstone in our fight against the American opioid abuse epidemic. While I believe that this bill does many great things, I have real concerns with provisions that include the definition of one pharmacy as a multiple location pharmacy that works off their own real-time database. Over the past few years, pharmacy benefit managers have used their money and power to purchase chain drugstores and force Americans away from their community pharmacists. I hope I can work with Chairman Upton and my colleagues to address this issue and issues related to pharmacy market manipulation to ensure that everything is being done to help and grow small business pharmacies in this country. Again, I want to thank the leadership and commend them for their in both chambers on this bill, and I look forward to sending something to the President's desk soon so we can better fight this epidemic. Thank you, Mr. Chairman, and I yield back.
Gentleman yields back. Chair will recognize the gentleman from Florida, Mr. Bilirakis.
Thank you, Mr. Chairman. I appreciate it so very much. I want to thank you, Mr. Chairman, all members and staff for their tireless efforts and hard work in bringing these workable solutions together in a bipartisan manner. We all have been touched one way or another knowing someone that has been affected by opioids, whether it's family, friends, or heartbreaking stories from constituents back home. Included in this report and the underlying opioid bill are provisions I have been advocating for on behalf of our true American heroes, our veterans and military that have sacrificed so much. My bills, the Promise Act and the Cover Act, will ultimately provide the quality health care our veterans have earned and deserve. Specifically, the Promise Act will update the clinical practice guidelines used to treat our service members for pain management, and the Cover Act will provide a pathway forward to implement complementary and integrative health alternatives within the VA. Additionally, a pilot program I authored was included that will provide veterans access to treatments provided in our communities that have shown positive results with those experiencing mental health or chronic pain. I urge all my colleagues to support the conference report and the underlying bill. In doing so, we uphold our promise to those we represent and send a clear message to our military that we have them covered. And I yield back. Thank you, Mr. Chairman.
Gentleman yields back. Chair would recognize the gentlelady from Indiana, Ms. Walorski, for an opening statement.
Thank you, Mr. Chair. As a member of the Veterans Affairs Committee, I'm very concerned over the issue of opioid overprescription. I'm honored to support this report. Veterans face higher rates of chronic pain, of polytrauma, and comorbidities, particularly PTSD, depression, and traumatic brain injury. Veterans are more vulnerable to addiction, and I've seen the problem firsthand with veterans coming into my office, often carrying a large bag or box of random pills. This crisis has escalated so quickly that the DEA has raided and is investigating several VA facilities, including one in my home state of Indiana. The Veterans Affairs Medical Center in Marion raised DEA suspicions after it purchased more prescription drugs than any other VA facility in the entire Northern District of Indiana. For too long, the VA's relied too heavily on the prescription of opioids. There needs to be more oversight of prescribing practices at VA facilities, and the VA needs to explore more effective non-opioid treatments. With that said, I want to highlight two important provisions in this legislation I've advocated for years. The first requires the VA to report to state prescription drug monitoring programs. These databases have proven to be an important and effective tool for tracking prescription practices, yet the VA is not required to report to them as other healthcare providers are. This will open up a window into VA prescribing practices that will help law enforcement identify problem areas that warrant further investigation. Secondly, the other provision allows the VA to consider alternative forms of treatment, such as FDA-approved medical devices for patients with chronic pain, giving the department more options to offer veterans than strictly prescribing opiates. Again, I want to thank you for the opportunity to be a part of this committee and to work side by side on this important issue facing our veterans and our nation at large, and I yield back.
Gentlelady yields back. Chair would recognize Mr. Meehan from Pennsylvania for an opening statement.
Thank you, Mr. Chairman. Mr. Chairman, I knew John Thomas Decker. He was a scholar, a leader, an outstanding athlete. He's not a statistic. Unfortunately, he had a sports-related injury that led to opioid abuse and ultimately heroin addiction and his death. And in so many ways, it's the name that's important because we're not talking about statistics. We're talking about real lives and families who have been struggling with addiction first and then ultimately the loss of a loved one. We have so much opportunity with this bill to do meaningful things now. As we are hearing the statistics of over 120 people a day who are dying, we must do something now. This is an ongoing process and a commitment we must make to continue. But we have so much, such as the sports-related intervention that can be done through high schools in the name of John Decker. The veterans treatment courts I worked on as a prosecutor that I have seen make a difference in the lives of those who have been struggling. Prescription monitoring that can assure that we identify those who are abusing the opioids. Infant safe care. So many pieces which are going to make a difference in the lives of those struggling families. I urge my colleagues on both sides of the aisle to stay focused on these real people and make sure that we do something meaningful today. I yield back.
Gentleman yields back. Chair will recognize the gentleman from Illinois, Mr. Dold, for an opening statement.
Thank you, Mr. Chairman, and it's an honor to be able to work with you and my colleagues on this conference committee. And you've heard the statistics, and frankly, I don't agree with my colleague, Mr. Meehan. This isn't about statistics. This is about families all across our country. Alex LaLiberte from Buffalo Grove, a high school student, had his life in front of him. A good student, a good athlete, lots of friends. When he went off to college, actually ended up dying from a heroin overdose. We have an epidemic on our hands in our country. And this legislation that we're working on today is really talking about hopefully giving a second chance at recovery for literally millions of people across our nation. Every single community is at risk. And so as someone that serves as the co-chair of the Illinois Suburban Anti-Heroin Task Force, I've seen firsthand what this is doing to families right back at home. No mother should have to walk into a child's bedroom to find them overdosed from heroin and prescription drugs. And so there is very meaningful pieces of legislation. Mr. Chairman, I'm going to submit the rest of my remarks for the record, but I do think that this is an incredibly important piece of legislation that requires our attention and requires that we step up and meaningfully attack what's going on right now across our country. I yield back.
Gentleman yields back. I would now ask unanimous consent that all conferee statements be made part of the record without objection, so ordered. I believe that all members that are here have given an opening statement or submitted them to the record. So I now call up the conference draft and ask the clerk to report.
Conference draft of the Comprehensive Addiction and Recovery Act of 2016.
So the conference draft will be considered as read. Excuse me. And I want to remind members of our amendment process. So the conferees of the sponsor's house will first discuss the amendment for 5 minutes, each for the majority and then for the minority. And then that house will vote on the amendment. If the amendment is agreed to, the process will repeat for the conferees of the other body. Chair now recognizes himself to offer an amendment, and the clerk will report that amendment.
Amendment to the conference report on S524 offered by Chairman Upton.
And the amendment will be considered as read. The staff will distribute the amendment, and the chair will recognize himself briefly in support of the amendment. This amendment provides technical edits to the conference report. Specifically, the edits ensure that grants authorized in the bill are carried out by the Secretary of HHS if an authorization of appropriations is included in that section. Amendment also makes minor classifications to Section 303, the opioid use disorder treatment expansion and modernization. And I would ask my colleagues to support the amendment. Are there members on the majority side that would wish to speak in support of the amendment? Seeing none, I will yield back the balance of my time. Are there members of the minority that would like to speak for or against the amendment? Seeing none, the vote occurs on the Upton amendment. Those in favor will say aye. Aye. Those opposed say no. Opinion of the chair, the ayes have it. The amendment is agreed to. So at this point, we yield to Mr. Grassley to see if the Senate will accept the House amendment.
I support the manager's amendment. I'd simply like to take a moment to thank Senator Upton and members.
I'm only in the House, not a senator.
What?
You said Senator Upton.
Oh, okay. I apologize.
Yeah. You can still call me Fred.
I support Chairman Upton and thank him for this opportunity. We ought to thank also members and staff of both chambers on both sides of the aisle for their work finalizing the report in preparation for today. It was truly bipartisan, bicameral team effort. Does anybody on the Senate minority want to speak? Then I'll yield back my time. Those in favor shall signify by saying aye. Aye. All opposed, no. The ayes have it, and the amendment is agreed to. The Senate has accepted the House offer on the Upton amendment, and the amendment is adopted.
And with that, the conference accepts the Upton amendment. Mr. Leahy's amendment was next in line. He will be back shortly, so when he returns, we'll take his amendment up. At this point, the gentleman from New Jersey has an amendment at the desk.
Thank you, Mr. Chairman. I do have an amendment at the desk.
Clerk will report the title of the amendment.
Discussion draft amendment to the conference report for S524 offered by Mr. Pallone.
And the amendment will be considered as read. The staff will distribute the amendment, and the gentleman from New Jersey is recognized, his side is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. This amendment would provide critical funding for opioid and heroin abuse treatment that is fully paid for with vetted bipartisan offsets. As we've all made clear, we're here today because we're in the midst of an unprecedented opioid and heroin crisis. Sadly, 2014 saw the highest number of drug overdose deaths than any other year on record. Our public health and treatment systems have not kept pace with the expanding epidemic. Those struggling with heroin or opioid addiction suffer from critical shortages in treatment access. Only 1 in 10 individuals suffering from substance abuse disorders receive any form of treatment. Given the tremendous gap between the supply and demand for substance abuse treatment, it's a farce to believe that we can mount a forceful response to this epidemic without providing additional resources to our communities and public health systems. And that's why I'm offering this amendment, which provides $920 million in immediate funding to provide critical tools to attack the opioid epidemic head-on, and further expands the type of providers who can treat opioid dependence with BUP. Mr. Chairman, the funding would go directly to the states to enable them to increase treatment capacity through cooperative agreements to expand access to medication-assisted treatment for opioid use disorders. This proposal provides for a targeted response where funding is allocated to the areas hit the hardest by this epidemic. It will empower states to adopt innovative solutions to increase treatment capacity, as well as make treatment more affordable for those seeking services. And the amendment is fully offset with bipartisan common sense offsets that we've all agreed to in the past, including, and I'll list them, 1, rolling back the start date on a policy that is currently enacted law to ensure that where applicable, Medicaid DME payments to states are no more than what we pay for the same items in Medicare. 2, changing the way Medicare pays for Part B DME infusion drugs to the, quote, ASP plus 6% methodology, which would result in a payment amount that better reflects the actual transaction prices. 3, reducing payments made to fraudulent providers in our federal health programs through a requirement that states report any provider that is terminated from one state's Medicaid program into a uniform and central database that is accessible to all states. And 4th, better protecting our Medicare and Medicaid program integrity algorithms. And last, ensuring the savings from an opioid policy we have all agreed to allowing for the creation of prescription drug management programs for at-risk Medicare beneficiaries in the Part D program, and that goes towards fixing the opioid crisis in this country. Mr. Chairman, I would urge my colleagues to vote in favor of this amendment. These are all policies we voted on before, and funding is needed to address this crisis in a meaningful way. Make no mistake about it, if we do not bring resources to the table in our fight against the opioid epidemic, we will fail. Anything less than a robust response to address this crisis will result in increased deaths, and place tremendous emotional and financial burdens upon our families and communities. And the need for action is now. We can't wait until the normal appropriation cycle to provide funding necessary to respond to this crisis. Additionally, Mr. Chairman, if Congress doesn't take a proactive approach in providing the necessary resources to combat this crisis, we will pay for it later through the collateral consequences of this epidemic, such as through our emergency departments and through the criminal justice system, meaning that we save money today at the expense of lives lost and increased spending later. So, Mr. Chairman, it's time for Congress to step up and provide states, communities, and families with funding they need to fight this epidemic. I urge my colleagues to support this critical amendment, and I yield back.
Gentleman yields back. I will claim the time in opposition. I want to say that I think all members on this conference committee believe that resources to fight the opioid epidemic are an important component in our strategy to help communities that indeed and families that are suffering. I would note that just this morning, the House Appropriations Committee announced that they'll be providing some $581 million to address opioid and heroin abuse. That's $525 million increase above the 2016 enacted level and some $490 million above the President's budget request. So this conference report includes many bipartisan priorities addressing the prevention, education, treatment, and recovery of opioid use disorders aimed at strengthening our nation's response to this horrendous epidemic. Just one example is an important provision in the bill to provide pregnant and postpartum women with proper treatment for substance abuse disorders. However, the amendment before us, it's not a bipartisan attempt at finding resources for opioid programs. In fact, at no point was this amendment discussed during the months of negotiations in the House and the Senate. Instead, the ideas included in the amendment were included in a letter that the Democratic conferees released yesterday afternoon. So I would agree with our appropriators that we have to devote significant resources to combat this epidemic, which is what they've done. They've announced this morning. But this amendment is not the right way to do it. Would note that S-524 passed the Senate with 94 senators voting in support. In the House package of opioids passed 400 to 5. Yesterday, over 100 groups voiced their support for the legislation. I think that we have to allow this bill, we must not allow the bill to be weighed down with a last-minute objection to major bipartisan priorities. So I would urge my conferees in the House to oppose the amendment, and would ask if any members on the majority side would also like to speak against it. If not, I would yield back the balance of my time. Roll call is being requested, right? When we did 5 minutes on each side. So so the clerk will call the roll. I would note that on this amendment, the conferees from Energy and Commerce, the General Conferees, Judiciary, and Ways and Means members will be voting, and the clerk will call the roll.
Mr. Pitts. Mr. Pitts votes no. Mr. Lance. Mr. Lance votes no. Mr. Guthrie. Mr. Guthrie votes no. Mr. Kinzinger. Mr. Kinzinger votes no. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Goodlott. Mr. Goodlott votes no. Mr. Sensenbrenner. Mr. Smith. Mr. Moreno. Mr. Collins. Mr. Collins votes no. Mr. Trott. Mr. Trott votes no. Mr. Bishop. Mr. Bishop votes no. Mr. McCarthy. Mr. Pallone. Aye. Mr. Pallone votes aye. Mr. Lujan. Mr. Sarbanes. Mr. Sarbanes votes aye. Mr. Green. Mr. Conyers. Ms. Jackson Lee. Ms. Jackson Lee votes aye. Ms. Chu. Ms. Chu votes aye. Mr. Cohen. Mr. Cohen votes aye. Ms. Etsy. Ms. Etsy votes aye. Ms. Custer. Ms. Custer votes aye. Mr. Courtney. Mr. Courtney votes aye. Mr. Meehan. Mr. Meehan votes no. Mr. Dold. Mr. Dold votes no. Mr. McDermott. Mr. McDermott votes aye. Chairman Upton.
Votes no.
Chairman Upton votes no.
That's we have proxies for, I think, all these members. So how is Mr. Sensenbrenner recorded?
He is not reported.
So I have a proxy. He votes no by proxy.
Mr. Sensenbrenner votes no.
How is Mr. Moreno recorded?
He is not recorded.
So I have a proxy. He votes no.
Mr. Moreno
by
votes
proxy.
no.
How is Mr. McCarthy?
Mr.
voted?
McCarthy is not recorded.
I have a proxy. He votes no by
Mr.
proxy.
McCarthy votes no.
And I would ask, I have the names.
Mr. Chairman?
Yeah, wait. How is Mr. Smith recorded?
Mr. Smith is not recorded.
You have a proxy for him, right?
I believe the only proxies I have that is Mr. Conyers has just returned, so he.
How is
can vote.
Mr. Conyers recorded?
I vote aye.
Mr. Conyers votes aye.
How is Mr. Lujan recorded?
He is not recorded. Mr. Lujan votes aye.
And how is Mr. Green recorded?
Mr. Green is not recorded.
Do you have a proxy for him?
I do not have a proxy for Mr. Green.
So, are there other members that are not recorded yet, Mr.? Yes, you may.
those were sent out. The rules in conference.
Yeah, the conference, it's my understanding that the conferences allow for proxy voting, which is, and we told all members that earlier, at an earlier point. Proxies would be included. Are there members that were called who have not voted or wish to vote or change their vote? If not, the clerk will report the tally. Wait, you know what? I might ask, how is Congressman Lamar Smith recorded?
He is not recorded.
I have a proxy for him, and so he votes no.
Mr. Smith votes no.
Now the clerk will report the tally.
Mr. Chairman, on that vote, there were 17 ayes. There were 11 ayes and 17 nays.
11 ayes, 17 nays. The amendment is not agreed to. Next amendment. Next amendment, gentlelady from Washington State.
Thank you, Mr. Chairman.
Ms. Murray.
I call up my amendment, number 4.
Clerk will report the title of the amendment.
Amendment to the conference report of S524 offered by Ms. Murray.
And the amendment will be considered as read. The staff will distribute the amendment, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. As I said in my opening statement, I am very glad that we've been able to reach some important bipartisan agreement on this issue, but our states need more to tackle the opioid crisis head-on. They need new investments. This amendment will provide $920 million in funding for states to expand access to prevention and treatment services, especially for those who cannot afford it. There is no reason we can't all support this amendment. We all agree the funding is desperately needed to help our communities stop the wave of overdose deaths and to properly treat addiction to prescription opioids and heroin. And specifically, we know that without more funding to expand access to medication-assisted treatment, states will not have the resources they need to put people on the path to recovery and save lives. We are debating a bill to address the opioid epidemic. It should include the funding necessary to actually fight that epidemic. So this amendment would provide funding to states for Medicaid-assisted treatment, allow nurse practitioners and physician assistants to prescribe the drug buprenorphine to help their patients cope with and recover from addiction, and importantly, the bill empowers these providers to treat patients while deferring to state scope of practice laws. This is critical for many of our rural communities that have been hit hard by this epidemic. The amendment is also fully paid for by a set of offsets that both parties have supported in previous votes and would not add a single dollar to the deficit. The bottom line is when someone is ready for treatment, we need to make sure our healthcare system is ready to treat them. And I'm very concerned that if we pass a bill that changes our nation's opioid policies but completely ignores the funding that would enable cities and states to put those policies into practice, that funding might never come. For far too many families, there is no later. There is no next time. This is the opioid bill this year, and frankly, people across the country are running out of time. So let's make the tough choices. Let's vote for this amendment, and let's make sure this bill takes an absolute necessary step forward in expanding access to the life-saving treatments that families across the country need. Mr. Chairman, I yield my additional time to Senator Wyden.
Mr. Chairman, do I have 2 minutes?
2:20.
Right.
2:28.
I'll be very brief. Colleagues, I strongly support the Murray Amendment. This is what I meant when I said we were talking about fighting an inferno with a thimble full of water. Just very briefly, according to research published in 2015 in the Journal of the American Medical Association, 80% of people who are dependent on heroin or painkillers are not getting treatment. Now, I don't want to tell families at home in Oregon and across the country that they ought to wait around for the appropriations process. My staff did some research. Apparently, it's been years since there's been a labor, health, and human services budget. So the question is, are we going to be able to tell families now that we are serious about securing the money when 80% of those who need treatment, according to research done by one of the most reputable groups in the country, say they're waiting? And I don't think they ought to be waiting around for the appropriations, process and the amendment to the amendment to the amendment that never really seems to get there when these families are in crisis. I urge colleagues to support the Murray Amendment.
The gentlelady still has a minute left as she yields back.
Mr. Chairman.
Gentleman from Tennessee is recognized for 5 minutes.
Yes, thank you, Mr. Chairman. I thank the senator from Washington, the senator from Oregon for their comments. I would not want the American people to get the wrong impression. We have bipartisan support here for the policy we're talking about today. 94-1 in the Senate, 400-5 in the House. And we have bipartisan support for funding the opioid abuse. It's much more than a thimbleful. It may not be a fire hose. But over the last 2 years, if you follow what the Senate Appropriations Committee has recommended, we've increased funding for opioids abuse by a factor of 7 times more money than 2 years ago. And if we do what the House Appropriations Committee announced today, it would be 14 times. So 7 times more than 2 years ago, 14 times more than 2 years ago. That's an opportunity for bipartisan support. That's the way we always do it in the Senate. We operate on 2 tracks. The senator from Washington and I worked last year on fixing No Child Left Behind with members of the House of Representatives. The president called it a Christmas miracle, but it didn't spend 1 penny because it reformed programs. We pass a defense bill every year. It doesn't spend 1 penny. We do that in the appropriations process. We pass an energy bill. It doesn't spend 1 penny. The bills are good, and so are the appropriations bills. So we are spending money on opioids, and we're doing it in the right way. So we should go ahead and finish our work today on reforming the programs, and then we should finish our work on funding opioids, which, as I said, the Appropriations Committee in the Senate wants to do at 7 times the rate of 2 years ago, and the House said today it wants to do at a rate of 14 times 2 years ago. That's a substantial improvement, and I think it would have bipartisan support. There's a second reason why I would oppose the amendment by my friend from Washington State, and that is its offsets come from the 21st Century Cures bill already passed by the House of Representatives with 344 votes. This is important legislation. It could be the most important legislation of the year if we can finish it up this year in the Senate and the House. Eventually it may include precision medicine and cancer moonshot and the brain initiative and a whole variety of other initiatives that will get treatments and drugs and discoveries through the process and into the medicine cabinets faster. It is different than the opioids legislation, but it is related, and the money to pay for it that the House found when it passed it with 344 votes last year is the same money. We can't spend that money, that same money, twice. So let's recognize that we have bipartisan support for funding, that we are spending money, that there are not, I cannot think of other provisions in the budget where we're spending 7 times what we did 2 years ago or 14 times what we did 2 years ago, and we're still talking about additional funding in the Senate in a bipartisan way, in the House in a bipartisan way. And surely let's don't take the money that we would use for 21st Century Cures, which the House did so well with, and try to spend the money twice. So I'm opposed to the amendment, but I'm in favor of the policy, and I'm in favor of funding. This is just not the way to do it, and we can get it done in the appropriate way at another time soon.
Other members wishing to speak against the amendment from the Senate side? If not, time has expired. The vote occurs on the Murray-Wyden-Leahy amendment. Those in favor will say aye. Aye. Those opposed say no.
No. No.
Opinion of the chair, the noes have it. Recorded vote is asked for on the Senate side, and the clerk will call the roll.
Mr. Grassley.
No.
Mr. Grassley votes no. Mr. Alexander.
No.
Mr. Alexander votes no. Mr. Hatch.
Is there a
By
proxy?
proxy.
No by proxy.
Mr. Hatch votes no. Mr. Sessions.
No by proxy.
Mr. Sessions votes no. Mr. Leahy.
Aye.
Mr. Leahy votes aye. Mr. Miss Murray.
Aye.
Miss Murray votes aye. Mr. Wyden. Mr. Wyden votes aye.
Other members wishing to change your vote? If not, the clerk will call the tally.
Mr. Chairman, on that vote, there were 3 ayes and 4 noes.
3 ayes and 4 noes. The amendment is not agreed to. Just the Senate votes. Other next amendment be offered by Mr. Leahy. Has an amendment at the desk. The clerk will read the title of the amendment.
Amendment to the conference report for 524 offered by Mr. Leahy.
And the amendment will be considered as read, and the staff will distribute the amendment to the Senate side, and the gentleman from Vermont is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman, and I helped put together the, I assume this is amendment OLL 16797. Is that correct?
Is that correct? It is.
Thank you. I worked to help create the heroin task force program. Got it in the Senate Cara legislation. I hear from law enforcement people all over the country, they have to have additional funds to combat traffickers. This not only affects Vermont, it affects states like Tennessee or Wisconsin, Michigan. I mention those only because they got critical support from this last year. Now, as drafted, the conference report removed direct task force funding. This would, and puts in a block grant, it would really place the task force program at risk. It would allow it to be spent on 9 other allowable issues. We really wanted this the way it was. Senator Grassley asked to add methamphetamine to it, and I agree with him, and I'm happy to. I know that the director of the Tennessee Bureau of Investigation, I just happened to mention that state, I wrote a letter on behalf of the Association of State Criminal Investigative Agencies in support of it. The fact is, there is no easy way out of all this. But the fact is, whether you're in a state with large cities or small areas, you need this help. And this is set up so that if like every state, you've also got some small areas, some rural areas, and everything else, you can get help. Your big cities can too, but you can get help in the smaller areas. It is something that has worked. That's the other advantage of it. All the police tell us, everybody else, they tell us it works. I think we should keep something that works. And I'll yield back my time, Mr. Chairman.
Mr. Chairman.
Gentleman from Iowa. He controls the time.
This amendment restores a separate standalone authorization for heroin and methamphetamine law task forces, as was provided in Section 204 of CARA when it passed the Senate. The amendment authorizes these task forces at a funding level reflected in the current Senate Commerce Justice State Appropriations Bill. The conference report currently provides resources for heroin investigations, but only as an allowable use under Section 201 grant program. The report does not authorize methamphetamine task forces at all. I know that these task forces are important for law enforcement in Iowa, and particularly the methamphetamine task force. Given how strained resources are at the state level, I support having these task forces funded through a separate authorization. I urge my colleagues to support the amendment. Does anybody else on the majority side want to speak? Okay, I yield back my time.
Yeah.
Distributed the correct
Apparently, the wrong amendment was distributed on the House side, but the amendment is being debated on the Senate. So it'll come back. We'll get you the right one. Apologize. The wrong amendment on this side was distributed. Yeah. I'm sorry about that. I wish the gentleman had raised a parliamentary question earlier. He would have had it in his paw earlier. All right. Senate yields back the balance of the time that the vote occurs on the Leahy-Grassley amendment. Those in favor will say aye.
Aye.
Those opposed say no. Chair, the ayes have it. The amendment is agreed to. The amendment now comes for debate on the House side, as it was passed in the Senate. And the gentleman from Virginia, Mr. Goodlatte, will control the first 5 minutes.
Mr. Chairman, thank you very much, and I rise in opposition to this amendment. Because the Comprehensive Opioid Abuse Reduction Act is designed to be just that, a comprehensive grant program, a purpose area was specifically included to provide for grants for locating or investigating illicit activities related to the unlawful distribution of opioids. Language that generally tracks the heroin task force language in Section 204 of S524. In contrast, this amendment would single out task forces, resulting in a disjointed rather than comprehensive DOJ grant program for addressing the opioid epidemic. The Leahy-Grassley amendment attempts to elevate these pet programs, which have only benefited a small number of select states and have never been supported in a House appropriations bill. In fact, the Justice Department's FY 2017 budget submission proposed to eliminate these programs. Indefensibly, the Leahy-Grassley amendment gives these task forces preferential treatment over drug and veterans treatment court programs, prescription drug monitoring initiatives, residential substance abuse programs, and all of the other extremely important efforts supported by the Comprehensive Opioid Abuse Reduction Act. Moreover, this amendment gives these task forces an exclusive authorization for appropriations that is not even fully offset for the purposes of the Comprehensive Opioid Abuse Reduction Act. It falls short by $15 million. The House went out of its way to offset the authorizations in the Act. This amendment would negate that effort. It is an incontrovertible fact that the funding level provided by the House for the Comprehensive Opioid Abuse Reduction Act is already significantly higher than the analogous authorization for appropriations included in S24, and it is fully offset under the House's cut-go protocol. The Comprehensive Opioid Abuse Reduction Act goes above and beyond to authorize new funding for its diverse purpose areas. Its authorization for appropriations was carefully developed as a result of a thorough consideration of both the Senate provisions and the House amendments language, as well as a disciplined recognition of the need to focus resources on opioid addiction at this time. The Leahy-Grassley amendment also introduces unnecessary duplication into the Comprehensive Opioid Abuse Reduction Act and attempts to shift some of the available funding from the anti-opioid efforts to methamphetamines. Under the circumstances, this amendment is simply a poor fit for this bill. A vote to reject the Leahy-Grassley amendment is not a vote against grants for investigating illicit activities related to the unlawful distribution of opioids. It is simply a vote in favor of a comprehensive approach that supports law enforcement efforts to address opioid abuse, one purpose of which is to authorize grants for the purpose of investigating illicit activities related to the unlawful distribution of opioids. And therefore, I urge my colleagues, the House conferees, to reject this amendment.
Does the gentleman yield back?
I reserve the balance of my time.
Gentleman reserves minute 38. Are there other members wishing to speak in opposition to the Leahy-Grassley amendment? And I would note it's Dr. McDermott indicated it's Amendment OLL 16797. So are there other members wishing to speak against the amendment? So the gentleman yields back.
I yield back.
And are there members on the House side willing to speak in support of the amendment? Seeing none, the vote occurs on the amendment adopted on the Senate side offered by Mr. Leahy and Grassley. Those in favor will say aye.
Aye.
Those opposed say no. No. Opinion of the chair, the noes have it. Amendment is not agreed to, and that's the way that it is. The next amendment is gentlelady from Washington State, Ms. Murray, has an amendment at the desk. I understand it's HEY 16852. And we'll have the staff, clerk will report the title of the amendment.
Amendment to the conference report for S524, offered by Ms. Murray.
And this amendment will be considered as read, and the gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. Local VA medical centers have patient advocates that are responsible for hearing complaints from veterans seeking care and helping them get the care that they need. But the VA does a poor job overseeing patient advocate system-wide, tracking complaints from around the country, and intervening where needed to make sure veterans get the high-quality care that they have earned. These failures led to tragedy in Tomah, Wisconsin, when no one would listen, when Jason Simkakowski raised concerns about how all the medications he was being given at the VA medical center were making him feel and act. Incredibly, the patient advocate at the facility where Jason was treated reported to the chief of staff, who was ultimately responsible for prescribing the deadly mix of medication that led to Jason's death. To prevent that from happening again, this amendment would establish a central and independent office of patient advocacy to help patient advocates effectively meet their obligations to veterans. This office will give patient advocates national level support if a medical center will not resolve the problem they are working on, and will ensure patient advocates report to an independent office rather than the medical center. A dedicated office reporting to the Undersecretary for Health will ensure that the program remains accountable to the needs of veterans and their families, and will prevent any undue pressure on advocates from the local medical facility leadership. This provision is widely supported by the Veterans Service Organizations and was agreed to by both sides of the Veterans Affairs Committee and is included in the Veterans First Act. I appreciate my colleagues including much of Senator Baldwin's vital legislation on opioid treatment in VA. This provision is a key component, and we should include it as well, just as the Veterans Committee has, and I move its adoption.
Does gentleman from Tennessee want time in speaking?
Mr. Chairman, I support Senator Murray's amendment, and as she says, so does the chairman of the Veterans Affairs Committee.
Are there other members wishing to? Mr. Grassley?
Yeah. For reasons beyond just this amendment, I think we ought to support it, because going back to August 2, 2014, we passed legislation we thought would dramatically change the direction of the VA, and it has accomplished very little. A new secretary has accomplished very little. We aren't doing enough for our veterans, and this is a step in the direction of Congress weighing in to make the necessary changes so that the VA gets the message.
Chairman, Senator Murray, Senator Grassley, Senator Alexander, and I totally agree on this. It's easy to get a parade and talk about veterans. What we have to do is start doing some of the things we need to actually care for them. This does. It should be included, and I thank the Senator from Washington State.
Other members of the Senate side wishing to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentlelady from Washington State. Those in favor say aye.
Aye. Aye.
All those opposed say no. Opinion of the chair, the ayes have it. The amendment is agreed to. The amendment now comes to the House side, and the chair will recognize himself for 5 minutes. This is a good amendment. We need to support it, and I would urge my colleagues to vote in favor of it. Other members wishing to speak on the amendment? Seeing none, the vote occurs on agreeing to the Murray amendment from the House side. Those in favor will say aye. Aye. Opposed say no. Opinion share, the ayes have it. The amendment is agreed to as part of the conference. Further amendments to the bill? Is the Jackson Lee amendment ready quite yet?
Mr. Chairman, we're ready. I don't know if we have the copies. Are we ready, Mr.?
Are there copies of the Jackson Lee Amendment, the revised? Not quite. So maybe
Copies are coming to the desk. So we'd like to go ahead. Pardon me?
Okay, well, why don't we go with the Jackson Lee Amendment as amended by, I think she has a UC request first, is that right, to change it?
I do, Mr. Chairman. And members, thank you for your courtesy.
All right, just if the clerk will report the title of the amendment.
Amendment to the conference report on S524 offered by Ms. Jackson Lee of Texas.
And to expedite things, I'll just say that gentlelady has an amendment to that she offers it by unanimous consent. Is there objection to the changes? No, we can't do it in the House, in the Senate yet. This is still just on the House side. It'll come to you if it passes here.
Okay.
So with that, the gentlelady's amendment, she's recognized for 5 minutes to offer her amendment.
Thank you, Mr. Chairman. I have unanimous consent that the amendment be accepted as amended. And I
without
believe,
objection, that is the case, and the gentlelady has 5 minutes in support of her amendment.
I thank you. So let me do this for the members. My apologies to you. We have been engaged in legislative compromise, and I'm very delighted that has happened. It is a sense of Congress that decades of experience and research have demonstrated that the opioid abuse epidemic and other, have demonstrated that a fiscally responsible approach to addressing the opioid abuse epidemic and other substance abuse epidemics requires treating such epidemics as a public health emergency, emphasizing prevention, treatment, and recovery. Let me thank my chairman and ranking member for working with me on this and ask my colleagues to support it. And that is, as I started out, I indicated that this is a significant moment in history. We want to move forward and to assure that, as many of my colleagues have said, that we have resources. But we also want to use this as a model. Many of you are need not to be reminded of the crack cocaine epidemic, which resulted in now almost 2 million people who are incarcerated in the nation's prisons, both local, state, and federal. And this point simply says we have found a model that deals with those who are addicted, who are not criminally involved, who are literally sick. And it is important to treat such epidemics, whether it's meth or other drugs, as public health emergencies, emphasizing prevention, treatment, and recovery. No matter where each conferee ends up on the final conference report, I think it's safe to say that the legislation we're considering holds a promise of saving and redeeming lives, tens of thousands. In many of our communities throughout America, we lost thousands of lives, families destroyed through the epidemic of crack cocaine, and certainly meth is another one. We know that our health professionals were overwhelmed. Our emergency centers were overwhelmed. In particular, those who were locked up, 80% of the defendants sentenced for crack offenses were African American, in spite of the fact that they were sick, addicted people with broken lives. I believe it is important, as we look forward to this conference, that we reflect what the American Public Health Association has indicated, that the ending of criminalization of drugs and drug consumers, prioritizing proven health treatment and harm reduction strategies, expanding and removing barriers to treatment and harm reduction services, including some innovative ways, is a way to address this sickness, this epidemic. And certainly, we have experienced that in many of our inner city communities. I can't tell you the funerals that I've gone to simply because people were addicted to crack, and I'm sure there are many other stories. I'm a member of the Opioid Heroin Caucus. I want to applaud them, and I want to applaud the conferees as well. The Jackson Lee Amendment is simply an explicit recognition and expression of the groundbreaking work done by this legislation and these conferees, and it shows that Congress listens to the American people, has courage to learn from the past, and is unafraid to embrace new, innovative, and promising methods of addressing the critical problem confronting our nation. Clearly, I want to commend the Chairman Upton and Goodlatte, Ranking Members Conyers and Pallone. I want to commend the Senate counterparts of Senator Leahy, Senator Grassley. And I simply want to say we buried too many people. We know what crack did. We know there are drug epidemics. We don't know what is next. My city just tried to do something about Kush users because of the drain on the public health system. We need to realize that we can deal with this in a way that is more than the way that we've looked at before. So I ask my colleagues to support the Jackson-Lee amendment, and I'm not sure, did the gentlelady want me to yield?
The gentlelady from New Hampshire.
Yeah, I yield to the gentlelady. I'm so sorry I didn't see you. Thank you.
Thank you very much, and thank you to Ms. Jackson-Lee. I'm speaking on behalf as co-chair of the task force, bipartisan congressional task force to combat the heroin epidemic, and I just want to join your comments. I come from a rural state. This is a new phenomenon for us, but I commend your amendment. I urge a bipartisan support. We have now 85 members, bipartisan, in our task force because we recognize that this is a public health emergency. Just very briefly, one county in my district, Sullivan County, they were able to implement treatment during incarceration, have a year-long program after, and brought the recidivism rate from the 80th percentile to the 20th percentile. I mean, that is something that everybody, Rs and Ds, can embrace. We can save tax dollars, and we can save people's lives. So I commend your amendment, and I urge a strong bipartisan vote.
I thank you. I yield back. I ask for support of the Jackson-Lee amendment. Yield back.
Gentlelady yields back. Chair to recognize the gentleman from Virginia, Mr. Goodlatte.
Thank you, Mr. Chairman. I want to thank the gentlewoman from Texas for offering this sense of the Congress amendment, and I want to especially thank her for working with me and others on the committee to modify the language to make it bipartisan and acceptable to all, and I commend her for doing just that. So I urge my
If the
colleagues
gentleman will
support
yield.
I'd be happy to yield.
I also want to thank the gentlelady from Texas for sharing the amendment with us yesterday, and for working with the gentleman from Virginia to modify it. And it is certainly a very good piece, an amendment, and I support it as well. And yield back to the gentleman from Virginia, who yields back.
I yield back.
All those in favor of the time has expired, so all those in favor of the Jackson-Lee amendment will vote, say aye. Aye. Those opposed say no. The opinion chair. The ayes have it. The amendment is agreed to, and the amendment now, as modified, goes to the Senate. And the chair would recognize the gentleman from Iowa. Seeing none, the vote occurs on the amendment passed by the House Conferees. Those in favor will say aye. Aye. Those opposed say no. And the opinion chair, the ayes have it. The amendment is included, therefore, as part of the conference agreement. Gentlemen, the next amendment is offered by the gentleman from Tennessee, Mr. Cohen. Has the amendment at the desk.
Thank you, Mr. Chair.
It's number 112, and the clerk will report the title of the amendment.
Amendment to the conference report on S524 offered by Mr. Cohen.
The amendment will be considered as read. The staff will distribute the amendment, and the gentleman is recognized for 5 minutes in support of his amendment.
Mr. Chairman, I, in my opening statement, talked about the messaging problem this Congress and our governments in general have had with heroin and marijuana and other drugs. A young man who I dated his mother, and we had a conversation one time at dinner about marijuana. And he smoked marijuana. He shouldn't have. He was young, but he did. And he said, nobody my age believes marijuana is bad in any way for you because we smoked it and we've seen it's not have the same effects on us people say it does. That young man died from a heroin overdose. He was from a very prominent family in Memphis, East Memphis, Fortune 500 world. I talked to a family in New York, friends of mine, young man. Young man's now a prominent actor and musician. And I asked him about marijuana several years ago. And he said, my friends all smoke it. They don't have a problem. Therefore, they don't see a problem with other drugs like cocaine and crack and meth and heroin. We have mismanaged the messaging of this for years. And so kids do drugs because they don't believe the government. They don't believe people when they tell them not to do heroin, not to do meth, not to do crack, not to do marijuana. Marijuana doesn't belong in that class. this amendment would tell NIH to study marijuana and see if it's an appropriate alternative to opioids. It may be, and study they should do. And I've got a further amendment, 109, that asks that it be rescheduled to Schedule 2 so they can study it. All of the groups that are in favor of this have asked me to withdraw the amendments. I believe that the best I can do today is message. So with the permission of the committee, I move to withdraw the amendment and hope that we will in the future better address this issue and speak the truth to what the effects of heroin are and opioids compared to marijuana.
Gentleman withdraws his amendment. I appreciate that. And the next amendment is offered by Mr. Wyden as Amendment TAM 16328. And the clerk will report the title of the amendment.
Amendment to the conference report for S24 offered by Mr. Wyden.
And the amendment will be considered as read. The staff will distribute the amendment to the Senate side. And the gentleman from Oregon is recognized for 5 minutes in support of his amendment.
Thank you very much, Mr. Chairman. Mr. Chairman and colleagues, this is an amendment designed to make sure that when you have task forces, and the conference report creates an interagency pain management task force, you don't create a situation where the fox guards the hen house. There are non-federal members that will be serving as part of this task force, and I think it's important that there be clear rules to make sure that there isn't bias in the work of the task force. There are going to be representatives of professional associations and pain advocacy groups, which often receive substantial amounts of funding from pharmaceutical manufacturers. I have raised this issue before with the Secretary of Health and Human Services and the National Academy of Medicine, and it seems to me if you're going to have non-federal participants, you ought to have clear guidelines to make sure the business of the task force and any financial interest is fully disclosed. As of right now, the conference language has no safeguards to ensure that either occurs. And this is an approach that does not micromanage what the rules of the road ought to be, but it requires that there ought to be rules. There ought to be rules to make sure that special interests don't hijack the work of the task force, and particularly in the opioid area, in effect encourage over-prescribing. So I hope my colleagues will support the amendment. It is a no-cost amendment. Obviously, it deals with conflicts of interest, and I urge colleagues to support this in a bipartisan way. I compare this to the kind of work that Senator Grassley and I have done over the years to watchdog for these kinds of abuses. I hope colleagues will support it, and I yield back.
Gentleman might want to yield to the gentleman from Iowa, Mr. Grass. It seeks the time.
I'd be happy to yield to my colleague from Iowa.
With my reputation for transparency and public policy, I'm going to support this recommendation and support this amendment and recommend that my colleagues do as well. I yield.
Mr. Chairman. Mr. Chairman, I'm in favor of transparency and public policy, but I think the conference report already provides that. It requires that the task force to provide the public with at least 90 days to comment on any recommendations made by the task force. So if we have an urgent situation here and we're trying to find the best practices for pain management to recommend to doctors and to hospitals and to others dealing with the abuse of pain medication, I'm afraid that having the Secretary develop guidelines and procedures in the federal government, that takes a long time, and it would discourage, I'm afraid, many of the best minds, the people who know the most about what we're talking about, from volunteering their ideas and suggestions. So I like transparency, I like openness, and I like the provision in the conference report that requires a task force to provide the public at least 90 days to comment. I also like the idea of having people who know the most about the subject available to tell us what the best practices are. So I'm going to vote no.
Mr. Chairman, I don't think I used all my time.
You didn't, but you yielded back. But I
Could I
bet
ask him
Mr. Alexander
for
will
one
yield to
additional
you.
minute?
Gentleman is recognized.
Thank you. The concern that I have is with respect to this task force. There are no standards in the bill with respect to conflicts. We've had this problem before, colleagues. I don't know why we'd want to open this up again, particularly at a time where there's been concern that through these task forces, there's been encouragement for overprescribing of opioids. So I thank my colleague for the extra time, and I very much appreciate Senator Grassley's support.
Yeah.
And the gentleman yields back?
Yeah. I think that we need a roll call on this, so.
Okay, the Senate will ask, a roll call has been requested on this amendment. The clerk will call the roll.
Mr. Grassley.
Aye.
Mr. Grassley votes aye. Mr. Alexander.
No.
Mr. Alexander votes no. Mr. Hatch.
Is there a proxy?
No by proxy.
Mr. Hatch votes no. Mr. Sessions.
No by proxy.
Mr. Sessions votes no. Mr. Leahy.
Aye by proxy.
Mr. Leahy votes aye. Miss Murray.
Aye.
Miss Murray votes aye. Mr. Wyden. Mr. Wyden votes aye.
Clerk, and other members wishing to vote or change their vote, seeing none, the clerk will call or report the tally.
Mr. Chairman, on that vote, there were 4 ayes and 3 nays.
4 ayes, 3 nays. The amendment is agreed to on the Senate side, which then sends it to the House side. Does the House have the language of the bill? Do we have it? I think we do. We do have it. I will claim the time on the majority side and would just note that this amendment to the Pain Management Task Force was never raised as part of either chamber's deliberations that we're aware of during committee or floor consideration. Particularly given some of the vague terminology used, it could have unintended consequences that have not been carefully considered, such as making qualified participants less willing to participate in the task force, including some of the foremost experts in pain management. It could also cast unwarranted doubt on the integrity or validity of the recommendations raised by participants, including patients and veterans. So I would respectfully urge my colleagues on the House side to vote no on the amendment and ask if anyone on the majority would like to speak. Seeing none, I yield back. Would recognize Mr. Pallone for 5 minutes on the minority side.
And I would disagree and urge that my colleagues support the Wyden amendment. It seems clear to me that it is moving in the direction of ensuring greater transparency, and I think it's important to address the potential conflict of interest. And so I would urge my colleagues to vote in favor of the amendment, and I would ask, Mr. Chairman, that we have a roll call.
Gentleman yields back, asks for a roll call vote, would note to the clerk that on this, on the House side, the general conferees, Energy and Commerce, and Judiciary are appropriate to vote on this amendment as passed by the Senate, and the clerk will call the roll.
Mr. Pitts. Mr. Pitts votes no. Mr. Lance.
Mr. Lance votes no by proxy.
Mr. Lance votes no. Mr. Guthrie.
Mr. Guthrie votes no by proxy.
Mr. Guthrie votes no. Mr. Kinzinger. Mr. Kinzinger votes no. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks.
Mrs. Brooks votes no by proxy.
Mrs. Brooks votes no. Mr. Goodlatte. Mr. Goodlatte votes no. Mr. Sensenbrenner.
Votes no by proxy.
Mr. Sensenbrenner votes no. Mr. Smith.
Mr. Smith votes no by proxy.
Mr. Smith votes no. Mr. Moreno.
Mr. Moreno votes no by proxy.
Mr. Moreno votes no. Mr. Collins.
Mr. Collins votes no by proxy.
Mr. Collins votes no. Mr. Trott.
Mr. Trott votes no by proxy.
Mr. Trott votes no. Mr. Bishop.
Mr. Bishop votes no by proxy.
Mr. Bishop votes no. Mr. McCarthy.
Mr. McCarthy votes no by proxy.
Mr. McCarthy votes no. Mr. Pallone.
Aye.
Mr. Pallone votes aye. Mr. Lujan.
Aye by proxy.
Mr. Lujan votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Mr. Green. Mr. Green votes aye. Mr. Conyers.
Aye by proxy.
Mr. Conyers votes aye. Ms. Jackson Lee. Ms. Jackson Lee votes aye. Ms. Chu. Ms. Chu votes aye. Mr. Cohen. Mr. Cohen votes aye. Ms. St. Ms. St. votes aye. Ms. Custer. Ms. Custer votes aye. Mr. Courtney. Mr. Courtney votes aye. Chairman Upton.
Votes no.
Chairman Upton votes no.
Members wishing to change their vote? Seeing none, the clerk will report the tally.
Mr. Chairman, on that vote, there were 11 ayes and 15 nays.
11 ayes and 15 nays. The amendment is not agreed to. Chair would recognize the gentleman from Tennessee, Mr. Cohen, to offer amendment number 109, and the clerk will report the title of the amendment.
Mr. Chair, as in the last amendment, I think this may go beyond our call on rescheduling marijuana, and I don't want to put people to that issue, nor do I want them to vote no on process rather than substance. And I hope that in the future we will get this straight, and we will at least have study on marijuana, which we should, and I would ask unanimous consent to withdraw this amendment at this time.
The unanimous request is granted. The amendment is withdrawn. The chair would now recognize Ms. Murray for an amendment, and the clerk will report the title of the amendment on the Murray 2, I believe, is the amendment on VA bonuses.
Amendment to the conference report for S524 offered by Ms. Murray.
And the amendment will be considered as read. Staff will distribute the amendment, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. I'll be short. This is a very simple amendment that adds language saying it is the sense of Congress that reductions due to the limitation on bonuses at the VA should not disproportionately affect lower wage employees. It also says VA should prioritize awarding bonuses to incentivize high-performing employees in those positions where the VA struggles to retain good people. The VA certainly needs important reforms in many areas, but I hope we can agree that the rank and file employees should not be targeted first over top executives. Both the majority and the minority on the Veterans Affairs Committee worked on this language for the Veterans First Act, and I hope we can support it for this language here.
Mr. Chairman, I support this amendment and urge my colleagues to support it as well.
Do you want to call for a voice vote?
Yeah. Those in favor say aye. Aye. Those opposed say no. The ayes seem to have it. The ayes do have it. And the amendment is adopted on the Senate side.
Amendment is adopted on the Senate side. Now comes to the House side. Let me say, I think this is a very good amendment. I look forward to voting for it. I would urge my colleagues to support it and yield back. Want to say anything? And with that, the vote occurs on the amendment offered in the House by the adopted amendment by Ms. Murray. Those in favor say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment is agreed to and is made part of the conference. Chair will now recognize Mr. Wyden.
Yes,
Oh, wait.
the Medicaid
I'm
windfall
told-
amendment.
Yeah, okay. GOE 16301, I believe is the number. And the clerk will report the title of the amendment.
Mr. Chairman, I am not offering that amendment.
All right.
But if you want to ask me to offer the Medicaid windfall amendment, I would be glad to
That's
do that.
fine.
Or I'd wait.
Go ahead. What you want to do the
Medicaid windfall.
ERN 16169.
Yes, that's it, Mr. Chairman.
All right, and the clerk will report the title of the amendment.
Amendment to the conference report for S524 offered by Mr. Wyden.
And the amendment will be considered as read. The staff will distribute the amendment, and the gentleman from Oregon is recognized in 5 minutes.
Mr. Chairman, I just want to I think there's a little confusion here. This is the amendment that I've authored on the Medicaid windfall, not the amendment on...
That's right. It's
You got it? Medicaid
correct.
windfall? Great.
Yep.
Okay. Colleagues, in the Medicaid program, the drug companies pay a rebate to the state and the federal government to offer their drugs to the 70 million Americans on Medicaid. Currently, drug companies making opioids pay the full rebate. There is a provision in this bill, however, that would allow the companies to get special treatment and a reduced rebate if they sell opioids that are considered so-called abuse deterrents. Now, the truth is, this is a windfall to the companies because they are already making their drugs in that manner, and they have been doing so for many years. So what this amendment does is it strikes the windfall to the manufacturers who, at least in some cases with overprescribing, have contributed to the problem, and instead funds care for low-income, pregnant women on Medicaid who very much need addiction treatment. These women who need assistance ought to have every opportunity to get back on track, and that's what this amendment would do.
the gentleman yield back.
I do. In
Gentleman.
fact, Mr. Chairman, only I want to wait and hear the response. I'm going to retain my time. Thank you, sir.
Reserve your time. Chair would recognize the gentleman from Tennessee on the Wyden amendment.
Unless Senator Grassley wants to go.
I would take my time off of Wyden's because I'm going to vote for this amendment. I think it's something that needs to be done, and this clarifies it. And so I urge my colleagues to vote aye.
Mr. Chairman.
Tennessee.
Mr. Chairman, Senator Hatch, who's chairman of the Finance Committee, has asked me to speak on this amendment, which proposes to strike bipartisan language included by the House of Representatives to encourage the manufacture of drug formulations that are more difficult to abuse, that are resistant to crushing up for injecting or snorting by drug addicts. It's a policy supported by the Food and Drug Administration and included in the President's budget request. So what the policy seeks to do is to provide an important incentive to develop abuse deterrent formulations for drugs such as opioids. That seems to me to be a good incentive, a good practice, one that's consistent with our goal here. On top of that, this amendment would replace that policy with another policy that's a very large issue and hasn't been fully vetted. We're having a large discussion in the Senate about whether or to what extent to allow Medicaid to pay for patients who go into institutions for mental health. To do that for all patients who might go is a very expensive proposition, and is something that we'll need to discuss on the Senate floor and find a way to pay for and be consistent and fair to all patients. So because it gets rid of a valuable incentive that could discourage opioid abuse, and because it gets into an area that hasn't been fully vetted and is a larger discussion on the Senate floor, I'm going to join Senator Hatch in voting no.
Mr. Chairman?
Gentleman still has 2 minutes left.
Thank you. Colleagues, this is a pretty obvious choice. We are going to choose low-income, pregnant women. You do that by voting for my amendment, or you go with the companies who are getting a windfall here. It would be one thing, colleagues, because Senator Alexander, as is often the case, raises an important issue. If we were talking about research, if we were talking about something that hadn't been done, I can see why there might be an argument for what's in the conference report. But the reality is the companies have been making the drug in the manner I've described for years and years and years. There's no need to give them this windfall. So this is a clear choice. I'm very appreciative of Senator Grassley and my colleague on the Finance Committee once again supporting an effort that in effect promotes the public interest, and I hope colleagues will support this.
Gentleman yields back. You call the vote.
As for a roll call vote.
Roll call is requested. Clerk will call the roll.
Mr. Grassley.
Aye.
Mr. Grassley votes aye. Mr. Alexander. Mr. Alexander votes no. Mr. Hatch.
No by proxy.
Mr. Hatch votes no. Mr. Sessions.
No by proxy.
Mr. Sessions votes no. Mr. Leahy. Mr. Leahy votes aye. Ms. Murray. Ms. Murray votes aye. Mr. Wyden. Mr. Wyden votes aye.
Other members wishing to change your vote? Seeing none, the clerk will report the tally.
Mr. Chairman, on that vote, there were 4 ayes and 3 nays.
4 ayes, 3 noes. The amendment is agreed to and now comes to the House conferees. And for the majority, Mr. Bilirakis is recognized for 5.
Thank you, Mr. Chairman. I appreciate this. I oppose this amendment because it strikes a bipartisan policy which was included in the House-passed bill and which the administration supports. This amendment strikes an important policy that represents a key step forward in combating opioid abuse. This policy fixes an unintended consequence with a Medicaid drug rebate program that effectively discourages drug manufacturers from producing opioids that are harder to abuse. Specifically, this policy would exempt abuse-deterrent formulations of drugs from the definition of line extension for purposes of calculating Medicaid rebates. This policy is bipartisan and has strong support from this administration. Supporting this amendment would remove a key policy to help combat opioid abuse, and I oppose the amendment. I yield back the balance of my time, Mr. Chairman. Thank you.
Gentleman yields back. Gentlemen want 5 minutes in support of the amendment.
Yes,
Gentleman is
Mr.
recognized for 5 minutes.
I would urge support for the Wyden amendment. In my opinion, every effort should be made to encourage and facilitate pregnant and postpartum women to seek substance abuse treatment, both for themselves and for their babies. This amendment ensures support for this vulnerable population when seeking treatment, will support continuity of care, and will maintain the continuity of care. So I support this amendment. It is, as Mr. Wyden said, fully offset, and I would ask for a roll call, Mr. Chairman.
Chairman.
Oh, I'll yield to my colleague.
Parliamentary inquiry.
Yeah.
What section is being struck by this amendment?
I don't have the amendment.
705.
705 is what I'm told. Further speakers on the minority side? Seeing none, roll call is requested. Would it?
No, I'm just want a brief moment. I want to support the Wyden amendment because over my legislative efforts, I've been working with pregnant women. I can't emphasize enough, as a woman, the importance of this initiative dealing with women when they're most vulnerable and they're working, I hope, to recover and to restore a better health for that unborn baby. I support the amendment. I yield back.
Thank the gentlewoman.
Gentleman yields back. A recorded vote has been asked for, so I would instruct the clerk that the general conferees, energy and commerce, and judiciary members are included on the vote, and the clerk will call the roll.
Mr. Pitts.
No by proxy.
Mr. Pitts votes no. Mr. Lance.
No by proxy.
Mr. Lance votes no. Mr. Guthrie. Mr. Guthrie votes no. Mr. Kinzinger. Mr. Kinzinger votes no. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks.
No by proxy.
Mrs. Brooks votes no. Mr. Goodlott. Mr. Goodlott votes no. Mr. Sensenbrenner.
No by proxy.
Mr. Sensenbrenner votes no. Mr. Smith.
No by proxy.
Mr. Smith votes no. Mr. Moreno.
Moreno, no by proxy.
Mr. Moreno votes no. Mr. Collins.
No by proxy.
Mr. Collins votes no. Mr. Trott.
No by proxy.
Mr. Trott votes no. Mr. Bishop.
No by proxy.
Mr. Bishop votes no. Mr. McCarthy.
No by proxy.
Mr. McCarthy votes no. Mr. Pallone.
Yes.
Mr. Pallone votes aye. Mr. Lujan.
Yes by proxy.
Mr. Lujan votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Mr. Green. Mr. Green votes aye. Mr. Conyers.
Yes by proxy.
Mr. Conyers votes aye. Ms. Jackson Lee.
Aye.
Ms. Jackson Lee votes aye. Ms. Chu. Ms. Chu votes aye. Mr. Cohen.
Yes by proxy.
Mr. Cohen votes aye. Ms. Estee. Ms. Estee votes aye. Ms. Custard. Ms. Custard votes aye. Mr. Courtney. Mr. Courtney votes aye. Chairman Upton.
Votes no.
Chairman Upton votes no.
Members wishing to change their vote? Seeing none, clerk will report the tally.
Mr. Chairman, on that vote, there were 11 ayes and 15 noes.
11 ayes, 15 noes. The amendment is not agreed to. Mr. Scott has an amendment at the desk to be offered with Mr. Pallone, as I understand it. And the clerk will, is it number 056? Clerk will report the title of the amendment.
Amendment to conference report on S524, offered by Mr. Scott.
And the amendment will be considered as read. The staff will distribute the amendment, and the gentleman from Virginia is recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, this simply adds educational and recovery programs for offenders in prisons, jails, and juvenile facilities to the Title VI block grant program that would be an allowable use for states. Mr. Chairman, this would allow pilot programs to enable us to figure out what works in these programs. As it's already been said, this is the opioid bill, and it'd be hard to explain a comprehensive bill that does not deal with persons already in prison. We're not going to solve any problems by putting people in jail and have them come out as addicted as they went in. This provision was part of the Senate passed bill that passed with virtual unanimous support, and was introduced in the House with over 100 co-sponsors, 40 of which were Republicans, so it has strong bipartisan support. So I would hope, Mr. Chairman, that we would adopt the amendment.
The gentleman yield.
I yield.
I'd like to, I'm pleased to join Mr. Scott in offering this amendment. The purpose of Section 601 is to provide funding to states for the implementation of a comprehensive response to this crisis, including by expanding education and prevention efforts, improving state prescription drug monitoring programs, and expanding access to treatment. This amendment would ensure that states include a focus on helping offenders recover from opioid use disorder as part of efforts to expand access to treatment services in the state. And such a focus will help ensure that offenders get the treatment and support services they need in order to recover from their substance use disorder, as well as to lead healthy and productive lives upon their release from incarceration. So I think this is an important amendment. I urge my colleagues to support this amendment and yield back to Mr. Scott.
Thank you to Mr. Scott, and thank you, Mr. Pallone. I want to join in this amendment, and I appreciate you bringing it forward. We have such a catch-22 that we're just locking people up and not giving them any treatment, and then we act shocked when they come out and end up back in this vicious cycle of committing crimes in order to pay for their drug habit. And so I've visited treatment facilities in-house within our incarceration system that are effective, that they can make a difference, they can turn people's lives around. And for my colleagues on both sides of the aisle, I just want to say it's a very cost-effective choice for the taxpayer, because we can drop those recidivism rates from, as I said, the 80th percentile down to the 20th percentile, put people back to work, they're in their communities, they're raising their families, and they've overcome this disease that we know as substance use disorder. So thank you. I yield back, and I appreciate your time.
You can reserve it. I'll give you an extra minute. Yeah. Let me take 5 minutes against the amendment. The amendment would direct the grants awarded under Section 601 that are administered by the Secretary of HHS to go towards incarcerated individuals. Currently, as we know, The Justice Department is responsible for providing treatment for offenders in prisons, jails, and juvenile facilities. So I support the goal of what the gentleman is trying to do. There is a clear delineation between who's responsible for care in different settings when someone is incarcerated or not. The amendment would make it less clear, I think, on the state level who is held accountable and responsible for providing treatment. So I would urge my colleagues to oppose the amendment and yield back my time. Does the gentleman still wish his minute?
Yes, thank you, Mr. Chairman. Reclaiming my time, I just say that it doesn't direct the states to do anything. It just makes it an allowable use. And there's not a lot of money on this line item, so it'd more be like pilot projects so we could find what works and what doesn't work. So I appreciate the support of the purpose of the amendment, and I hope the amendment will be adopted.
And I would, you know, in the future, I'd like to work with the gentleman. Maybe we can get language that we can accept on our side. But I appreciate the amendment. With that, time has expired. Those in favor of the amendment will say aye.
Aye.
Those opposed say no. No. If you need a chair, my mic was on. The noes have it. The amendment is not agreed to.
Mr. Chairman, I have a unanimous consent for introduction into the record. I recognize?
Yeah.
Thank you, Mr. Chairman. I'd like to add into the record a statement from the American Public Health Association for Science, for Action, and for Health. I ask unanimous consent to place this into the
Without
record.
objection.
Thank you. I yield
It's
back.
included. It's my understanding there are no further amendments to be offered. Is that correct? Any member wish to offer an amendment that was put in by last night? So, seeing none, we've now concluded debate on the amendments filed for today's meeting of the House and Senate Conferees on S-524, the CARA Act of 2016. We will amend the text of the conference report to reflect the amendments adopted today. I want to thank members and the staff for their hard work today and over this Congress on this very, very important issue. At some point following the meeting, we'll announce a unitary time and place for member to review the final conference report text and to then sign that conference report. Without objection, staff is authorized to make technical and conforming changes to the legislation approved by the committee today, so ordered. And without objection, the committee stands adjourned.